Marami ang nagbago sa maiksing panahon. Pwede akong matakot sa patuloy na kumakalat na sakit, mag-isip, mag-alala ng husto at mawalan ng pag-asa. Mahirap ang buhay ngayon. Madaling sumuko sa pagsubok na ito. Pero hindi. Imbis na magalit at malungkot, haharapin ko ang pagsubok na ito. Sa halip na bumalik sa dati, mas gusto kong harapin at maging handa sa bagong mundo. Mas magiging mabuti ako. Pwede akong magmukmok sa bahay. Ilang buwan na akong nakakulong. Gusto ko sanang umalis, gawin ang gusto kong gawin, tulad ng dati. Pero mas pinipili kong magpasensya. Ang magtiis sa bahay para maging ligtas. Ang magtiyaga, sumunod sa mga patakaran para sa kapakanan ng lahat. Magpapalakas ako. Gagawin kong maging maingat, maging responsable sa aking mga galaw. Ayaw kong mahawa at makahawa sa iba. Pwede akong mainis sa dami ng ipinagbabawal. Ang daming kailangang sundin. Anumang oras, maaari kang masita. Pero sa ganitong panahon, mas kailangan ang respeto at pagmamahal sa isa't isa. Kailangang intindihin na ang protocols ay para sa ikabubuti ng lahat, hindi lamang sa iilan. Pwede akong maging makasarili at wag isipin ng iba. May sarili akong mga problema. May sariling pamilyang umaasa. Pero sa abot ng aking makakaya, hindi ko ipagkakait ang tumulong. Ang magbahagi ng mga biyayang natatanggap ko sa aking kapwa. Ngayon, mas gusto kong magtiwala sa Diyos, ang manalig, katulad ng ginagawa ng iba. Patuloy akong magdarasal, mananalig, magiging responsable, at aasa sa magandang bukas.
Bakit kailangang magpabakuna? Bakit nga ba vaccination? Ang pandemyang ito ay kumuha ng maraming buhay at patuloy pa nitong nilalagay sa peligro ang buhay ng nakakarami. Pinahina din nito ang ating ekonomiya at maraming Pilipino ang nawalan ng trabaho dahil dito. Sa pagkatuklas ng bakuna laban sa COVID-19, nagkaroon tayo ng oportunidad na malabanan ang pandemyang ito. Sa tulong ng mga bakuna, ay may iwasan natin ang sintomas ng impeksyon at posibleng maiwasan din ang malalang impeksyon at matigilan ang pagkalat nito. Gayunpaman, gaya ng iba pang mga bakunang ginagamit sa nagdaang dekada, ang abilidad nitong protektahan ang ating komunidad ay tataas lamang kung hindi bababa sa 70% ng ating populasyon ay bakunado. Halimbawa, kung ang iyong barangay ay mayroong 100,000 katao, hindi dapat bumaba sa 70,000 ang dapat mabakunahan upang matiyak na proteksyon ang buong komunidad. Kaya ating tandaan, ang pagbabakuna ay hindi lamang para sa iyo o sa iyong pamilya. Ito ay para din sa iyong barangay, lungsod at probinsya. Aling mga bakuna ang gagamitin sa Pilipinas? Sa ngayon, may limitadong supply ng bakuna sa buong mundo. Sa katunayan, halos 80% ng stock sa buong mundo ay nabili na ng mga mayayamang bansa. Dahil dito, walang iisang kumpanya ang maaaring mag-supply ng 110 million na bakuna sa Pilipinas, kaya naman nakikipag-usap ang ating gobyerno sa 7 manufacturers. Sinisiguro natin na ang mga bakuna na ito ay makakatanggap ng Emergency Use Authorization at kung may EUA sila, doon lamang sila bibilhin at gagamitin ng ating gobyerno para sa ating vaccination program. Nagbibigay ang EUA ng assurance o katiyakan na ang bakuna ay dumaan sa masusing pagsusuri at nirerekomenda ng mga independent na eksperto sa atin. hindi mo rin kailangan mag-alala. Ang bakuna laban sa COVID-19 ay hindi magbibigay sa'yo ng COVID na sakit. Magkano ang babayaran ko para mabakunahan? Ibibigay ng gobyerno ang bakuna ng libre. Wala kang dapat bayaran para magpabakuna. Sino ang unang makakapagpabakuna? Dahil kailangan nating masiguradong patuloy na makakapagtrabaho ang ating health system para maalagaan tayo, ang mga medical frontliners ang unang makakatanggap ng bakuna. Susunod dito ay yung mga eligible na senior citizens dahil sila ay nasa greatest risk ng severe infection o kamatayan. Alam natin ito dahil sa ating lokal na datos na mas mapanganib ang COVID-19 sa mga matatanda. Ang pagkakasunod-sunod na kung sino ang unang makakatanggap ng bakuna ay natukoy sa tulong ng mga eksperto. Kailan at saan ka dapat magpabakuna? Ang inyong national government ay nakikipag-ugnayan sa mga lokal na pamahalaan upang maihatid ang bakuna sa inyo. Ang lokal na pamahalaan or LGU nyo ang maghahanda ng pagpaparehistro at pag-ayos ng schedule ninyo sa pagpapabakuna. Mangyaring abangan ang anunsyo at instructions na magmumula sa inyong mga mayor or governors ukol dito. Ano ang kailangan mo bago magpabakuna? Habang hinihintay natin ang pagdating ng mga bakuna, kumuha lamang ng impormasyon sa mga mapagkakatiwalaang sources. Magtanong lamang sa mga licensed medical professionals ukol sa wastong pagbabakuna para sa COVID-19. Matuto rin tayong mag-verify ng ating mga nababasa o naririnig. Tanging tamang impormasyon lamang ang makakapaggabay sa atin sa ating desisyon na magpabakuna. Ang inyong health history ay mahalaga din sa pagtukoy kung dapat ka bang bakunahan o hindi, kung anong bakuna o angkop sa iyo. Kaya naman, importanteng seryosohin natin ang health screening na ito. Magpakita sa araw ng inyong screening at ideklara ang inyong complete health history, gaya ng allergies o mga risk factors o mga sakit noon. Masusuri ka lamang ng tama ng isang health professional kung ibibigay mo ang mga hinihiling na impormasyon. Kung hindi ka naman sumailalim sa screening, hindi ka maaaring i-book o i-schedule para sa pagpapabakuna. Ano ang kailangang gawin sa araw ng pagbabakuna? Pumunta kayo sa vaccination site kung saan ka nakalista. Huwag kalimutan magsuot ng face mask at face shield. Bago ka turukan ng bakuna, kailangan mong pumirma ng isang informed consent. Sa pagpirma ng dokumentong ito, ay pinapatunayan mo na voluntaryo kang magpapabakuna at alam mo ang mga benepisyo at posibleng side effects nito. Huwag din kalimutan ang mga minimum public health standards habang nasa vaccination site. Katulad lamang nagpag-maintain ng 1 metrong layo sa iba at pagsasanitize ng inyong kamay habang naghihintay. Pagkatapos mong mabakunahan, ay makakatanggap ka ng isang vaccination card at malilista dito kung kailan ka nabakunahan at kung kailan ang iyong susunod na appointment. Mananatili ka muna sa vaccination site ng 1 oras upang obserbahan ka sa mga di pangkaraniwang na sintomas o adverse events. At dahil importante sa amin ang inyong kaligtasan, ay patuloy kang babantayan sa susunod na 1 taon or 12 months. Ano ang dapat gawin pagkatapos magpabakuna? Maaari kang makaranas ng side effects tulad ng sa trangkaso, pero mawawala naman ito dapat pagkatapos ng ilang araw. Huwag mag-alala, senyales to na bumubuo ng proteksyon laban sa sakit ang katawan mo. Karamihan nakakaranas ng lagnat o sakit at normal ito. Kontakin ang iyong healthcare provider kung ang pamumula o pagiging sensitibo ng lugar kung saan ka tinurukan ay lumala pagkatapos ng 24 na oras. At kung nag-aalala ka pa sa iyong mga sintomas o kung hindi sila nawawala pagkatapos ng ilang araw. Importanteng may ulat mo ang mga ito sa health authorities para maaral ng mga eksperto kung konektado nga ba ang mga sintomas mo sa bakuna o hindi. Ayaw naming mag-alala ang publiko ng hindi kinakailangan. Sa mga bakuna na meron tayo ngayon, ay kinakailangan ang 2 turok ng bakuna upang mabigyan ka ng inaasam na proteksyon. Kailangang Magpaturok ka pa rin ng pangalawang bakuna kahit nagkaroon ka ng side effects. Maliban na lamang kung pinayuhan ka ng iyong healthcare provider na ipagpaliban ito. Paano ko patuloy na maproprotektahan ang sarili ko at ang aking pamilya? Gaya ng ibang pagbabakuna, nangailangan pa rin ng oras para sa iyong katawan na bumuo ng proteksyon sa COVID-19. Pero tandaan, ang pagbabakuna ay isa lamang sa maraming mga solusyon laban sa pandemya. Kailangan pa rin natin magpatuloy sa pagsuot ng mga face mask, pagsunod sa 1 meter physical distancing, pag-iwas sa mga kumpulan, at madalas na paghugas ng kamay upang maprotektahan ang inyong sarili at ang inyong pamilya. Paano natin masisiguro na ang ibabakuna sa atin ay tunay at mabisa? Ang mga bakuna ay biological products at sensitibo ang mga ito. Maari lang itong magbigay ng proteksyon sa atin kung sila ay authentic o galing sa totoong manufacturer at kung sila ay naitratransport o nahahatid mula factory hanggang vaccination site sa tamang temperatura. Hindi pwedeng masyadong mainit o masyadong malamig. Kung hindi, pwedeng masira ang bakuna at hindi na ito magiging epektibo. Bagkus, pwede pa itong makasama sa ating kalusugan. Kaya naman, siguraduhin natin na ang bakunang iyong matatanggap ay nagmula sa lehitimong manufacturers at naihatid sa tamang temperatura.
Tara sa Vida Vaccination!
Marami ang nagbago sa maiksing panahon. Pwede akong matakot sa patuloy na kumakalat na sakit, mag-isip, mag-alala ng husto at mawalan ng pag-asa. Mahirap ang buhay ngayon. Madaling sumuko sa pagsubok na ito. Pero hindi. Imbis na magalit at malungkot, haharapin ko ang pagsubok na ito. Sa halip na bumalik sa dati, mas gusto kong harapin at maging handa sa bagong mundo. Mas magiging mabuti ako. Pwede akong magmukmok sa bahay. Ilang buwan na akong nakakulong. Gusto ko sanang umalis, gawin ang gusto kong gawin, tulad ng dati. Pero mas pinipili kong magpasensya. Ang magtiis sa bahay para maging ligtas. Ang magtiyaga, sumunod sa mga patakaran para sa kapakanan ng lahat. Magpapalakas ako. Gagawin kong maging maingat, maging responsable sa aking mga galaw. Ayaw kong mahawa at makahawa sa iba. Pwede akong mainis sa dami ng ipinagbabawal. Ang daming kailangang sundin. Anumang oras, maaari kang masita. Pero sa ganitong panahon, mas kailangan ang respeto at pagmamahal sa isa't isa. Kailangang intindihin na ang protocols ay para sa ikabubuti ng lahat, hindi lamang sa iilan. Pwede akong maging makasarili at wag isipin ng iba. May sarili akong mga problema. May sariling pamilyang umaasa. Pero sa abot ng aking makakaya, hindi ko ipagkakait ang tumulong. Ang magbahagi ng mga biyayang natatanggap ko sa aking kapwa. Ngayon, mas gusto kong magtiwala sa Diyos, ang manalig, katulad ng ginagawa ng iba. Patuloy akong magdarasal, mananalig, magiging responsable, at aasa sa magandang bukas.
Isang maganda at pinagpalang umaga po sa ating lahat. Ang pagtitipon po natin ito ay isang simula ng ating pagsasama-sama bilang mga katuwang ng iba't ibang kagawaran ng ating pamahalaan para po sa tagumpay ng ating National Vaccination Program. Bago po tayo magsimula ay bigyang daan natin ang tinig ng panalangin mula kay Reyma at Janelle na mga estudyante ng Immaculate Conception School ng Pamarawan, Malolos, Bulacan.
Sa ngalan ng Ama, ng Anak, ng Espiritu Santo. Amen.
Panginoon, sana po matapos na po ang sakit na COVID-19 para po hindi na nag-iisip lagi sila nanay at tatay.
Natatakot na daw po sila na baka isang araw ay may magkasakit sa amin o kaya mawalan sila ng trabaho kasi po yung iba pong kilala namin ay nagka-COVID at yung iba ay natanggal sa trabaho.
Nahihirapan po sila lalo na ang pamilya nila. Sana po maging maayos na ang lahat at mabalik na sa dati ang buhay. Sana po makalaro na ulit sa labas kasama ang aming mga kaibigan. Hindi na po kami hihingi ng para sa sarili namin. Para na lang po sa mas nahihirapan na may mga sakit, lalo na po yung tinamaan na COVID at yung mga nawala ng pag-asa. Bigyan mo lang po kami ng malakas na katawan at sana po kahit madaming problema, ay maging masaya pa din kami lagi kasama ang aming buong pamilya.
Sa ngalan ng Ama, ng Anak, ng Espiritu Santo. Amen.
Muli, isang magandang umaga po sa ating lahat. Ako po si Cecil Rojas mula sa External Affairs ng Unilab Inc. Salamat po at kayong lahat ay nakasama namin sa webinar na ito. Sa matagal na pong panahon, kami po ay naging kapartner na ng Catholic Bishops' Conference of the Philippines. Ganon din po ng Catholic Media Network, ng Episcopal Commission on Healthcare, ng Social Communication, ng Commission on Youth, ng CBCP Nasa Caritas Philippines at ng Chameleon's Order of the Ministers of the Infirm para po sa ilang mga proyekto sa ating mga komunidad. Ngayong araw pong ito, tayong lahat ay nagsasama-sama para magtulungan sa isang napakahalagang proyekto ng ating pamahalaan. Malaki po ang hamon ng National Vaccination Program para sa COVID-19. Ang nasabing vaccine po natin ay isa sa mga solusyon na nagbibigay ng pag-asa, hindi lamang po sa ating bansa, kundi pati na rin sa buong mundo upang masugpo na po ang pandemyang dulot ng COVID-19. Ngayong umaga, kasama ko rin po ang aking kasamahan sa External Affairs. Magandang umaga, Rex Dayaw.
Magandang umaga, Ate Cecil. Isang napakagandang umaga po sa inyong lahat. Gaya po ng sinabi ni Ate Cecil sa ating webinar na gagawin ngayon, ay nais namin kayong bigyan ng tama at sapat na kaalaman tungkol sa COVID-19 vaccines mula sa ating mga eksperto. Sasamahan din po tayo ng ating mga inimbitang speakers from the Department of Health at ng local government ng Davao unit upang ipaalam nila sa atin ang kanilang plano sa pagbabakuna based on the national and the local level. Sa pamamagitan po ng webinar na ito ay nais po sana naming buksan ang isipan ng nakararami upang pawiin ang inyong mga pangamba tungkol sa safety at efficacy ng mga bakuna at naway maging daan din po ito upang tayo makatulong upang mapababa ang vaccine hesitancy at mapataas naman ang bilang ng mga Pilipinong handang magpabakuna. Mamaya po ay mayroon din tayong mga Q&A session para sa mga tanong ninyo na sasagutin naman ng ating mga resource persons. At ngayon po, upang magbigay ng mas komprehensibong pananaw sa ating paksa, ay nais ko pong tawagin si Bishop Rex Ramirez, ang chairman ng CBCP Episcopal Commission on Healthcare para sa kanyang welcome remarks.
Baka nagkakaroon lamang ng konting technical difficulty si Bishop Ramirez dahil siya po ay live from Biliran. Rex, tama ba?
Oo nga, hindi po ako si Bishop Rex, katukayo ko lamang po siya at baka po nagkakaroon lang siya ng ilang technical difficulty. Alam po namin na excited ang bawat isa pagdating sa paano ba talaga yung mga masagutan yung mga agam-agam natin pagdating sa pagbabakuna, Ate Cecil. Nagkaroon na tayo ng session last March 1 at naging mabunga ito. So siguro balikan natin si Bishop Rex, Ate Cecil.
Habang wala pa rin si Bishop Rex, Tokayong Rex niya, ay let's move on para sa isang mensahe ng ating Secretary of Health, Secretary Francisco Duque III.
Sa ating po mga kasama sa paglilingkod sa bayan at mga minamahal namin mga obispo, pari, lay leaders at mga samahan ng simbahan, isang maganda at maaliwalas na araw po sa inyo. Bago ang lahat, ang DOH ay taus-puso nagpapasalamat sa inyong lahat. Tunay na malaking hamon sa ating bansa ang pagpapatupad ng malawakang pagbabakuna na isa sa atin magiging daan upang mapabilis ang ating pagpuksa sa pandemyang COVID-19. Ngunit sa bisa ng atin iisa at nagkakaisang kilos, kakayanin natin itong pagtagumpayan. Isang mahalagang aspeto po ng pagpapatupad nito ay ang tama at sapat na kaalaman, lalo sa larangan ng datos, na magiging batayan upang matugunan ang vaccine hesitancy na nararanasan ng ating kababayan. Kasama ng mga vaccine experts at iba pang kagawaran ng gobyerno at pribadong sektor, tuloy-tuloy kaming makikipag-ugnayan sa inyo sa pamamagitan ng alaga sa kalusugan ng pamayanam o AKAP webinars upang mapanatili namin kayong updated sa usapin ng vaccination. Kaisa ninyo ang DOH sa gawaing ito upang isulong ang pag-unawa ng publiko sa halaga ng mga bakuna at ng ating pagbabakuna. Magkaisa po tayo sa pagpawi ng kanilang pag-aalala o agam-agam. Bigyan natin sila ng pag-asa at lakas ng loob pagkat abot kamay na ang solusyon sa pandemyang ito. Bigyan din natin sila ng katiyakan na nagkakaisa tayo sa pagsisikap na mabigyan ng proteksyon ang ating bansa. Naway, walang pagmamaliw ang inyong suporta at dedikasyon sa ating adhikain. Kakayanin po natin ito para sa ating kapwa Pilipino. Maraming salamat at muli mabuhay tayong lahat.
Maraming salamat po, Secretary Duque. Ngayon naman po, mula pa rin sa Department of Health, bigyan daan natin ng mensahe ni Yusek Rosario Vergere.
Umaga po sa inyong lahat. Isang malusog na araw sa ating lahat. Nagagalak po kami galing sa Kagawaran ng Kalusugan na makasama ang pamunuan at mga miyembro ng Catholic Bishops' Conference of the Philippines or CBCP sa ating town hall ngayong umaga. Mag-iisang taon na po ang laban natin kontra COVID-19 at malayo na po ang ating narating mula nung magsimula tayo sa pandemyang ito. Ang pagpapatupad at ang ating pagsunod sa minimum public health standards ay tunay na nakakatulong upang limitahan ang pagkalat ng virus. Ang sama-sama po nating pagsusuot ng face mask at saka face shield, pagsunod sa physical distancing at malimit na pagsasanitize ng kamay ang nagpoprotekta sa ating mga sarili at kapwa Pilipino laban sa COVID-19. Ngayong 2021, isang panibagong yugto sa ating laban ng COVID-19 ang ating paparating. Sa pamamagitan ng pakikipagtulungan at pakikipag-ugnayan ng ating gobyerno at ng mga eksperto mula sa iba't ibang sulok ng mundo, magkakaroon na po tayo ng bakuna laban sa COVID-19 na magbibigay sa atin ng proteksyon laban sa sakit na ito. Magiging kritikal na bahagi ng ating daan tungo sa pagbangon ang pagsiguradong ang bawat Pilipino ay may matatanggap na ligtas at epektibong bakuna. Sa araw na ito, unti-unti nating na tayong magsisimula na ang pagdating ng mga bakuna na ating ibibigay sa ating priority groups, mula po sa ating mga bayaning healthcare workers at frontliners at kasunod na ang ating mga senior citizens, vulnerable groups, hanggang sa ibang bahagi ng populasyon. Narito po tayo ngayon upang sama-samang ihanay ang ating kilos sa pagtatagumpay ng ating pambansang pagbabakuna laban sa COVID-19. Hindi lingid sa ating kaalaman ang kasulukuyang kalagayan ng vaccine confidence sa ating bansa. Base sa ating mga survey, marami pa rin pong mga nag-aalinlangan sa pagbabakuna laban sa COVID-19. Buhat nito, naniniwala po ang Kagawaran ng Kalusugan, ang IATF at ang Vaccine Cluster na ang estado po ng ating vaccine confidence ay nakasalalay sa sama-samang pagtutulungan ng mga lider ng iba't ibang komunidad at grupo sa Pilipinas. Hiling namin ay makapagbigay linaw ang town hall na ito tungkol sa kahalagahan ng pagbabakuna at mapawi po ang ating agam-agam tungkol sa COVID-19 vaccines. Salamat po sa inyong panahon. Kami po ay nasasabik na maging kasangga ng CBCP sa pagkakampyon sa ating pagbabakuna. Maraming salamat at magandang araw po sa inyong lahat.
Maraming salamat Secretary Duque and Yusek Vergere para sa isang makamakabulohang mensahe. Para po sa welcome remarks ni His Excellency Bishop Rex Ramirez, ang chairman ng CBCP Episcopal Commission on Health, ito po ay babasahin ng Executive Secretary of CBCP Episcopal Commission on Healthcare, Father Dan Cancino. Father Dan?
Sa ngalan po ni Bishop Rex Ramirez na sa kasalukuyan ay nasa Diocese of Nabal, nasa Biliran po. Medyo unstable po ang kanilang connection doon. Ito po ang kanyang mensahe para po sa ating lahat. Magandang umaga po mga kapatid, Your Excellencies, Reverend Fathers, Reverend Sisters, honored resource persons and guests, and co-workers in the healthcare ministry, together with other healthcare professionals, dear friends. A heartfelt welcome to this webinar, Ating Alamin, Bakuna sa COVID-19. The Catholic Bishops' Conference of the Philippines and its Commission on Healthcare and its partners are indeed very appreciative of your presence here today. Despite the obvious limitations of this online town meeting, I am sure many share my relief at the fact that this is the one mass gathering in which we are not burdened once again with the necessary health protocols that have now become the new normal. Many are excited about the vaccines which are beginning to be used to curb the COVID-19 pandemic. I don't think that any other vaccine in the history of the world has ever caused both widespread interest and much heated controversy. This online gathering is meant to help us better understand issues and concerns related to the vaccines and vaccination against COVID-19. We consider the development of these vaccines in positive light, for it gives hope to many after this year-long pandemic. As our initial video presentation reminded us, mahirap ang buhay ngayon. In the understanding that vaccination is one of, if not the main weapon we have against the worsening of the pandemic, this webinar aims to help government in its current information drive concerning the vaccines against COVID-19, to encourage more interest and especially greater acceptance of these, and to promote a better understanding of the options available to our people and the Christian faithful. Our faith allows us the possibility to receive a vaccine with a clear conscience. Although we cannot, of course, be forced against our will in this, and there are also many and valid reasons not to be inoculated. Yet we are encouraged to get the vaccination, even by the Holy Father himself, Pope Francis, who has had his second dose or vaccine shot already, and who sees it as a concrete contribution to the common good, a manifestation of Christian concern. The 500 years of Christianity celebration in our country has the theme Gifted to Give. If the vaccine is for us a gift, then by receiving it, we can also give to others, especially to those most vulnerable, health and wellness. Thank you for joining us here today, and may God bless you all.
Maraming salamat, Father Dan Cancino, sa pagbasa ng mensahe ni Bishop Rex Ramirez. Alam po namin marami kayong katanungan tungkol sa COVID-19 vaccines at katulad po ng sinabi ni Father Dan, ito pong pagbabakuna ay isang regalo natin sa mga taong nakapaligid sa atin. Pero alam po namin na marami pa kayong tanong such as, ano nga ba itong bakuna laban sa COVID-19? Maraming tanong kung ito ba ay safe, kung anong bakuna ba yung talagang effective, kung ano nga ba yung benefits kapag binakunahan at kung paano ang management ng side effects nito. Ang totoo po, isang eksperto po ang sasagot nito. Kasama po natin ngayon ay isang board member ng Philippine Society for Microbiology and Infectious Diseases. Let us all welcome Dr. Gemeline Garcia. Doc Jemmy, the floor is yours.
Thank you, Sir Rex, and good morning to everybody. I am very privileged to deliver this lecture on behalf of my colleagues from the Philippine Society for Microbiology and Infectious Diseases. Let me just share my screen. So as you can see, this lecture or vaccine primer has been prepared by the Adult Immunization Committee of the Philippine Society for Microbiology and Infectious Diseases. And we also borrowed some slides from the lecture of Dr. Nina Gloriani. So I'll be presenting on their behalf. Okay, this will be the content of my talk this morning. So we will have a short overview of infection and the immune response. And then we will go into discussing the COVID-19 vaccines, the different types, the approval process, and the vaccine prioritization. Okay, let me start by giving you a simplified version of the COVID-19 infection. So you see here at the top of the figure, this is the SARS-CoV-2, which is the virus that causes COVID-19. So meron po siyang mga spike protein, it has M proteins on the surface, and it has its RNA or the genes inside. So the virus will enter the cell by attaching to specific receptors using the spike protein. So pag naka-attach na siya, it will enter the cell and it will fuse with the vesicle, and then the genes or the RNA will be released inside the cell. Tapos ito pong RNA na to ang gagamitin ng cells para po mag-produce ng bagong protein which will become a new virus particle that will be released into the body. So ganyan po ang process of viral replication during the infection. Okay, so now, kung meron tayong infection, the body will elicit an immune response. So let's say the new virus has been released into the body. So this will be recognized by what we call as the antigen-presenting cell. And yung antigen-presenting cell na yan, they will express some of the components of the virus on the surface, such as yung mga viral peptides or yung mga spike proteins. And these viral particles will be recognized by the T helper cell. Yung T helper cell po, yan po yung isa sa mga panlaban natin sa infection. And the T helper cell will then stimulate our immune response by activating a dual pathway po. No? We have the B cells that will produce antibodies so that when we get exposed to the virus, the antibodies will attack the virus and present them for destruction, cell destruction. And there's also the cytotoxic T cell pathway where the viral particles are destroyed. So dalawa po yung mechanism for our immune response. And after an infection, we will have long-lived memory B and T cells. So mag-stay sa katawan natin yung mga na-activate na B cells and cytotoxic T cells, and when you get exposed again to the same pathogen, to the same virus, then it will be easier for your body to elicit an immune response and you will not have a second or a new infection. So for the vaccines, what is being done is that from the virus, we get some parts of the virus. So pwedeng yung RNA, pwedeng yung spike protein, So assuming this is the spike protein, and this is the one that's incorporated into the vaccine. So when you introduce the vaccine into our body will recognize it as foreign, and therefore we will form new antibodies specific to that antigen or to that protein. So ganyan po yung mechanism of how the vaccines somewhat simulate an infection but not really causing an infection. It just elicits an immune response from our body. So, ang vaccines, they are classified or characterized by their immunogenicity and reactogenicity. So, what is immunogenicity? So, this is the ability of the vaccine to elicit a measurable immune response. So, looking at the figure here on your right, yung panel A, the one above, this is what happens during natural infection. So during infection, your body will recognize that you have a foreign antigen, which is the virus, no? So being recognized as foreign, then it will stimulate your T cells and your antibody production. However, this is not immediate. So it takes some time for our body on first exposure, no, to be able to stimulate enough T cells and to be able to form enough antibodies in order to combat or control that infection, such that even before you develop your immune response, nagdevelop ka na ng disease. So already manifested with the signs and symptoms of the disease. When you recover, the virus is eradicated from your body, but your antibodies and your T cells remain. So that when you get exposed to the same virus a second time, you already have this weapon in the form of your T cells and your antibody to fight off that infection. So you are able to counter it, and on the second time around, you will not express the signs and symptoms, meaning you will not develop the disease. So what happens during vaccination? So what happens is the vaccine introduces the antigen. So some parts of the virus, such as the spike protein or the RNA or an inactivated virus itself. And this will stimulate your body to form your T cells and your antibodies, such that you do not develop the disease, but you develop the antibodies and the T cells, so that when you get exposed to the infection at a later time, then you already have antibodies to fight it off. So that's the mechanism of how vaccines work. We introduce the antigen so that we develop antibodies. We stimulate the T cells so that when we get exposed to the real thing, to the real virus, we already have an immune response developed. Okay. How about reactogenicity? So reactogenicity is a subset of reactions that occur soon after receiving a vaccine. So they are physical manifestations of the inflammatory response to the vaccine. Most commonly, these are local reactions that may manifest as swelling, redness, or pain at the injection site. And there's also stimulation of some inflammatory factors. Now, when these inflammatory factors get into the bloodstream, that's when you develop systemic symptoms or general symptoms such as headache, fever, and fatigue. So that's how reactogenicity is defined. Okay. So how do we acquire immunity to a certain virus or to a certain pathogen? It can be one of two ways. It could be from natural infection, as I already explained earlier. When you get infected, naturally you will develop antibodies to that infection. Or when you get immunized with a vaccine, then you also develop antibodies to that specific virus or pathogen, so that you get protection when you get exposed again to the same pathogen, and therefore you do not develop the disease and you do not pass it on to others. And this is what we call as herd immunity. Okay, so what is herd immunity? No, lagi na po natin yang naririnig recently. So it is defined as the indirect protection from infection conferred to susceptible individuals when a sufficiently large proportion of immune individuals exist in a population. So to illustrate, kindly look at the figure on the right. So at the top of the panel, so assuming there's no herd immunity. So yung mga blue figures, these are the susceptible individuals, susceptible to infection. And the red figure is the one who is infected. So if everybody around him is susceptible, then he will pass it on to everyone who get exposed to him. Such that, for example, one person passes it on to 3 other individuals, then these 3 other individuals will pass it on to 3 other individuals. And therefore, this results to an outbreak, an epidemic, or a pandemic. Now, when you have herd immunity, no, assuming there is a significant proportion of the population that is already immune by recovery or by vaccine, these are the yellow figures. No, if an infected individual enters that community and he exposes a lot of people, he will only infect the susceptible individual. So nare-reduce po yung transmission of infection. And the second one who gets infected, when he gets exposed to other patients or to other people in the community, but they are immune, then it blocks the transmission of infection. So that is the importance of herd immunity. So it requires a certain number of individuals to reach a herd immunity threshold. And this can be done through natural infection kasi nga magde-develop naman tayo ng antibodies or through vaccination. So syempre, ayaw naman po natin na mag-develop tayo ng herd immunity through natural infection kasi kung hintayin pa natin na 70% of the population gets infected and immune, it will be a lot of morbidity and mortality for us. So that's why we want to achieve herd immunity through vaccination. And talking about vaccines, specifically for the COVID-19 vaccines, we have several types of vaccines. No? Meron pong tinatawag na inactivated or killed virus. So it is the viral particle, but it is inactivated such that it is not able to replicate in your body. Or we also have yung tinatawag po na live attenuated virus. This is a live or weakened virus such that it cannot produce infection when injected as a vaccine. Other types of vaccines include or involve subunit vaccines such as the most common is the spike protein. So meron tayong mga recombinant viral vectors where viruses such as adenovirus is used as a carrier of the genetic sequence coding for the spike protein. So yung protein coding for, yung gene sequence coding for the spike protein is contained in the viral vector. For COVID, most commonly the adenovirus vector. We also have DNA sequences or yung mga genes encoding for the spike protein are contained in a vaccine. And then third, we also have yung very popular na mRNA vaccine where also gene sequences for the spike protein are contained in the vaccine. But there are also other types of subunit vaccines such as yung mga spike protein recombinant subunit. So this is produced by recombinant DNA technology. And then lastly, there are also synthetic peptides as a type of COVID-19 vaccine. Okay, let us go through the timeline for development of vaccines. So this is the traditional timelines po, no? So it will start with an exploratory studies in the laboratory, and then it will proceed to preclinical trials, no, in animal studies. And when they have good findings from preclinical trials, then there is a submission for an investigational new drug that will go into 3 phases of clinical trials. So phase 1, phase 2, and phase 3. So phase 1 usually involves only a small number of subjects, no? And primarily looking at the safety of the new product. And then it progresses into a phase 2 trial involving more subjects. And then the phase 3 trial, where we involved thousands, tens of thousands of subjects in order to evaluate more the efficacy and safety of the new investigational drug. And when you have good findings, efficacy and safety findings from the phase 3 trials, then that's a time that the biologics license application is submitted for FDA review and approval. And once approved, that's the only time that they can go into manufacturing and commercial distribution of the product. So generally or traditionally, this process takes about 10 to 15 years. So napakatagal. And because of the urgency of this pandemic, and we all know the morbidity and mortality that it has brought us, not only in the Philippines, but all over the world, we have now what is called the potential accelerated timeline, resulting to an emergency use authorization. So makikita natin dito, still we have exploratory and preclinical stages, but the stages of the clinical trials like phase 1, phase 2, phase 3 may be overlapping. No, maaaring hindi pa tapos yung phase 1, pumasok na sa phase 2, or yung phase 2, pumasok na sa phase 3. Ang study, pwedeng sabay-sabay sila or overlapping. One is only slightly ahead of the other. And even with only the preliminary finding from the phase 3 trial, as long as it has been demonstrated that the benefit outweighs the potential risk, then the FDA can issue an emergency use authorization so that the product will be made available to those who need it most, while we are still collecting more information from the phase 3 clinical trial. So nag-overlap din po yung sa clinical trial and yung sa FDA review and approval. So ano po ba ang nangyayari sa clinical trial? So in a phase 3 clinical trial, we have tens of thousands of volunteers, and they are assigned randomly into the vaccine group and the placebo group. So when we say placebo group, there's no active ingredient. So it may contain just saline solution. No, and we compare how many in the vaccinated group will develop the disease as compared to how many in the placebo group will develop the disease after vaccination. And that's how we determine the efficacy of the vaccine. And at the same time, we also monitor for safety. So, what is an emergency use authorization? It is done when a medicinal product, in this case a vaccine, is made available before a full application is approved by the Food and Drug Administration. So to receive an emergency use authorization, the vaccine developers must demonstrate that the vaccine's known or potential benefit outweighs the known and potential risk. So in an EUA, the FDA authorizes the use of vaccines in groups of people that are at high risk for COVID infection and will most likely benefit from the vaccine. So this provides us access to the vaccine even if the long-term follow-up of the studies are still ongoing. But of course, it is all still required of the vaccine manufacturers to provide us with long-term data for continuing evaluation. So the EUA is not a lower standard, but it is a flexible and tailored standard so that we can make the vaccine available to the high priority groups. Okay. Now, how do we determine whether a vaccine is safe for us? So as I mentioned earlier, meron po tayong mga local side effects, no, such as pain, redness at the injection site, and also systemic side effects, no, such as fever, headache, fatigue. No, and in clinical trials, these are graded as being mild, moderate, or severe, as expected or versus unexpected side effect, or they are also characterized as being either common or rare side effects, and as being serious or non-serious. And in the clinical trials, they also determine the causality. Are these side effects due to the vaccine, or are they due to other conditions not related to the vaccine? So for us to use a certain or a specific vaccine, the benefits from the vaccine should outweigh the risks or the side effects. Okay. On the other hand, how do we determine the efficacy of the vaccines? So as I mentioned to you earlier, in a clinical trial, we divide the subjects into those who are given the vaccine and to those who are not. And we develop them for them, we monitor them, for the development of disease or signs and symptoms related to the disease. And if they manifest the disease, they are classified either as having mild COVID, moderate COVID, or severe COVID, or asymptomatic infection. And from the trials, we will see the efficacy ranging from 50 to 70 to 95%. So this means that it is the protection provided from COVID disease. And we also see in several literature yung protection against severe disease. No? So yan po yung titingnan natin sa iba't ibang vaccines. Okay, this is just an overview of the different types of vaccines. We will not go through each of them, but let me just focus on three, no? Yung Pfizer mRNA, yung Astra, and the Sinovac Coronavac vaccine, because these are the ones that have EUA for the Philippines. So for the Pfizer vaccine, it has demonstrated 95% efficacy against symptomatic COVID, and 89% efficacy against severe COVID. The adverse events were mostly mild to moderate, lasting 1 to 2 days. No, there were 11 cases of anaphylaxis per million doses, no, within 15 minutes. No, so hindi naman po ganon ka-common. No, the antibodies from the vaccinated individuals were slightly less effective against the new variants, but still provide protection. Next is the Oxford Astra vaccine. This vaccine uses the chimpanzee adenovirus spike protein. The spike protein in the chimpanzee adenovirus as a viral vector. It has demonstrated 70% overall viral efficacy against symptomatic COVID and 100% efficacy against severe disease. And also, the adverse events were generally well tolerated and mild to moderate in severity. There is one report of transverse myelitis, possibly related to the vaccine, but was later on ascribed to idiopathic spinal cord demyelinization in a predisposed individuals. And in their report, it appears to still work well versus the UK variant, but data are still being collected for the South African variant. Next is the Sinovac Coronavac vaccine. This vaccine has demonstrated 50% efficacy among healthcare individuals in the study in Brazil, but it has 78% efficacy to protect you against hospitalization, and it has 100% efficacy against severe disease. No? It also has favorable safety data, mainly pain at the injection site, mostly mild to moderate, and there were no difference in severity of symptoms between different doses that they looked at in the study. There is no data yet on its efficacy against the other variants, the new variants. So overall, based on the data that we have seen, safety profiles of most COVID-19 vaccines are generally good. So yung mga side effects are mild to moderate and they are very transient, lasting only for 1 to 3 days. The serious adverse events that were reported were considered not related to the vaccine. Adverse events of special interest identified for mRNA vaccines are being investigated. No? This include lymphadenopathy, anaphylaxis, Bell's palsy, and 2 rare events of platelet depletion. And overall, vaccine efficacy ranges from 50% to 95% against symptomatic COVID. So yung whether mild, moderate, or severe. But if you look at the protection given against severe COVID, it's quite good at 89 to 100%. You know? Data on viral efficacy, vaccine efficacy against variants showed slightly lower efficacy against the UK variant and very low efficacy for the South African variant. So here, this is the prioritization of the vaccination program. No, it can be either of the three criteria: by priority groups, as listed here, or by geographic location if there is a high incidence of cases in a geographic location, but you need to balance that with the supply chain or the availability of the vaccine. Or you can use priority groups as a criteria. For example, for healthcare workers who are frontliners, for seniors who are at highest risk, you can prioritize them by each group, or for indigent citizens. No. So this is our prioritization or the priority groups for our vaccination as of February 5. So first in the list will be frontline healthcare workers, followed by senior citizens 60 years old and above, and then followed by persons with comorbidities not otherwise included in the two above, such as persons with diabetes, hypertension, heart disease, no? And then this is followed by frontline personnel in essential sectors, including uniformed personnel. And then the indigent population that are not included in the list above. And this is followed by the other groups, as you can see in the list. So for now, who cannot be vaccinated? So those who are aged less than 16 years old are not yet eligible because we do not have safety and efficacy data yet for this age group. Those with allergy to polyethylene glycol or polysorbate, they will not be eligible for the mRNA vaccine, such as the Pfizer vaccine, kasi may component po ng PEG yung Pfizer vaccine. And those who develop severe allergic reaction after the first dose. This is actually the only absolute contraindication to getting a vaccine. If you develop a severe allergic reaction to your first dose, then you cannot receive your second dose anymore. For the next one, for this group of people, they are still eligible, but we will delay or defer the vaccination. So for example, for those who have symptomatic COVID, because they are already infected and they will develop an immune response to the current infection. So they will be eligible for vaccination 90 days after their current infection, because based on literature, there is very, very low risk of reinfection within 90 days of a COVID infection. Pregnant women in the first trimester, we will delay the the vaccination. And then if you receive any other vaccine in the past 2 weeks, then you might have to delay your COVID vaccination. So dapat wala kang na-receive na vaccine within the last 2 weeks before getting your COVID vaccine. The third group are the ones who needs clearance. No? This include those with autoimmune disease, yung may mga lupus, may HIV, may mga cancer, transplant, those who are on steroid treatment, those who are terminally ill. Strictly speaking, hindi po contraindication, hindi bawal. As a matter of fact, they are high-risk groups and we want them vaccinated. But kaya lang nilagay dito na may clearance because you need to discuss with your physician on the proper timing of getting your vaccine. Like, for example, if you're a cancer patient undergoing chemotherapy, your chemotherapy will suppress your immune system. There has to be a good timing between the schedule of your chemotherapy and your vaccination. So you need to discuss this with your doctor. But you are still eligible. And then special precautions are for those who have allergy to food, medicines, or asthma. But you can still receive the vaccine. It's not a contraindication. It's just that you will be monitored closely because of your risk for developing an allergic reaction. And then also those who have a history of bleeding or who are taking anticoagulants, then you will be monitored during the vaccination. Okay, so now, why does my choice matter to others? It is because of the concept of herd immunity, as I already discussed a while ago. Again, to illustrate, Now, when no one is immune, there are two people who get the disease, then they pass it on to everyone who they get into contact with. Then a lot of people will develop the infection from exposure to these two initially infected individuals. Now, looking at the figure above, for example, you have 5 persons in the community who were vaccinated. Yan po yung mga yellow figures. And then you have 2 persons who get the disease. They will still pass it on to the susceptible individuals. So meron pa rin 16, no? For example, na nadagdagan na na-infect ng dalawang individual, no? But if you have herd immunity or community immunity, then mas marami pong immune na individuals, no, in the community. So kahit na may dalawang infected, no, kung may herd immunity ka na, yung mga nakapaligid sa kanila ay bakunado na, then hindi na po nila yan mapapass on dun sa mga susceptible individuals. So somehow, we provide indirect protection to the susceptible individuals who, for one reason or another, may not be eligible to receive the vaccine. So, ang assumption po kasi, if COVID, if one infected individual infects 3 other persons, by computation of the scientists, we need to protect 2/3 of the population. We need to immunize or vaccinate 2/3 of the population to achieve herd immunity. So kung may 100 million tayo, 2/3 of that is around 67 million. Kailangan natin maprotektahan or mabakunahan ang 67 million para tayo mag-develop ng herd immunity such that yung mga susceptible individuals na hindi maaaring makareceive ng vaccine will be indirectly protected. But of course, aside from the vaccine, we still do not forget our minimum public health standards or our BIDA solution. So, as enumerated here, bawal ang walang mask at face shield, isanitize ang kamay at iwasan ang kulob na lugar, dumistansya ng 1 metro or limitahan ng physical na interaction sa iba, at alamin ang tamang informasyon. And this will be supported by the vaccine. So when we still observe the minimum public health standards and supplement it with vaccination, then the more that we get protected against COVID infection. So in summary, vaccines are critical to achieve herd immunity and end this pandemic. Estimates suggest that 2/3 of the population must be vaccinated to achieve herd immunity. And all vaccines with published phase 3 data showed high degrees of efficacy and safety, as well as high rates of ability to prevent severe disease. No, a critical review of phase 3 clinical trial data is required for all vaccines in order to reliably assess both the efficacy and the safety. Lastly, I want to share with you this Swiss cheese model, no, in our pandemic defense. Yung Swiss cheese po kasi, di ba, may mga butas siya in different parts at hindi yan pare-pareho kung saang part. So iba-ibang location. So kung titingnan natin, kung each slice of Swiss cheese is our defense against COVID infection. So for example, physical distancing, proper ventilation, wearing of mask, hindi na individually this interventions are not 100% effective, no? Kung isang intervention lang ang gagawin mo kasi makakalusot pa rin yung virus. But this shows that if we perform or we continue to observe several strategies all at the same time, at nasa huli niyan yung vaccination, then mas malaki po yung chance natin na ma-block yung virus from going all the way through. So yung vaccine is not the ultimate, but it is one of our major defenses so that ma-stop natin yung transmission of COVID. And lastly, I want to let you know that yesterday I already got my COVID vaccine. And this is because I'm a frontliner. I want to protect myself because I continue to see patients. And I also want to protect the people who I interact with. This is my last slide. If you have any questions regarding the presentation, you can contact the Secretariat of PISNID. Thank you very much. Back to
Isang
you, Sir Rex.
virtual applause para kay Doc Jemmy. At Doc Jemmy, maraming salamat po sa inyong tinuturing kong kabayanihan kasi hindi kayo pinilit pero pinili nyo na maging bayani para sa iba. Maraming salamat po for having the courage na mabakunahan kahapon. So parang sabi ni Doc Jemmy, yung pagbabakuna ay parang maiisip natin para kang nagpatayo ng bakod na hindi ka basta-basta mapapasok ng nagmagnanakaw, or kung mapasok ka man, may security guard ka pa para lumaban dun sa mga magnanakaw. And also para po sa mga attendees namin na nandito sa Zoom, kung meron po kayong tanong kay Doc Jamie at sa ating mga presenters, please put in your questions sa Q&A box at mamaya po isisikapin namin siyang sagutin. Dumako naman po tayo sa isa pa nating next speaker. Siya po ay isang community pediatrician at founder ng isang non-government organization, ang Hope in Me Club. Magandang umaga po kay Dr. Maria Cristina I. Alberto. Dr. Tina.
Okay. Magandang umaga po sa ating lahat. It is my privilege and my honor to be part of the webinar of the CBCP. And for this part of the webinar, we would like to focus and highlight on the role of the church in advocating for vaccinations to be able to end the pandemic and the crisis that it has brought to many people and families across the world. Sabi nga po ni Santo Papa noong nakaraang World Day of the Poor, we should stretch forth our hands to the poor. Ngayon po, yun din po sana ang gusto nating sabihin sa ating mga church leaders, sa ating clergy at sa ating mga Catholic faithfuls, that we should also stretch forth our hands to the Filipino people to be able to understand better what COVID vaccine is all about and to be able to help us end this pandemic. Before we begin this webinar, I want us to reflect on what Pope Francis said before he took his COVID-19 vaccine. And Pope Francis said, I believe that morally, everyone must take the vaccine. It is the moral choice because it is not just about your life, but also the lives of others. We are all aware of the COVID-19 statistics. Today, there are around 115 million who are infected by the coronavirus, accounting for more than 2.5 million deaths around the world. In the Philippines, more than 500,000 has already been infected with 12,000 deaths. This is the usual phase of the COVID-19 victims. We are all aware of the complications of COVID-19, of its mortalities and morbidities, and the tragedies it has brought to all those who have been sick and to all the families who have lost their loved ones to the COVID-19 virus. But beyond this, there are other victims of COVID-19, and these are the people and the faces that we have often missed because of the chaos and the confusion that the pandemic has brought us. Parami po ng parami ang mga naghihirap. Marami po ang nakakalimutan ang mga nasalaylayan ng lipunan, gaya ng mga magsasaka, mga street children, mga laborers na hanggang ngayon ay naghihirap at mas lalong naghihirap dala ng pandemya na ito. Across the world at lalo na po sa Pilipinas, napakadami na pong mga kumpanya ang nag-shutdown, creating more and more unemployment. Napakadami na pong mga mamamayan ang nawawalan ng hanap buhay at hindi po natin alam kung hanggang kailan matatapos ang pandemya na ito. The impact of COVID-19 crisis on households in the National Capital Region was examined by the UNICEF and the UNDP. Ang survey na ito was done across 3,700 households in the NCR. And everybody in the survey said that they suffered major financial losses. Many have lost their jobs. Many have lost their income. And according to the research, by the end of the year, as much as 44% the poverty rate will increase. In terms of child protection, the impact of COVID among children is severe. Among 50% of the children who were surveyed said that they were victims of physical and emotional abuse. Habang tumatagal po ang pandemic na ito, these statistics will become worse and worse than what we are seeing right now. Pope Francis once said that keeping our gaze fixed on the poor is difficult. At dahil sa pandemic na ito, and because of our own fear of being infected, because of our own fear of the COVID-19 virus, it has made it even more difficult for us to fix our gaze on the poor. Our fear has immobilized us, and while fear grips the world, more people are left to suffer. Sa ngayon, bilang isang scientist at bilang isang doktor, isa lang po ang solusyon na nakikita namin para po sana mag-end ang pandemic na ito and to end the suffering of many people across the world. According sa mga expert, at least 70% of the world's population needs to be vaccinated to attain herd immunity. At hindi po matatapos ang pandemic na ito unless much of the population has been vaccinated. However, sadly po, according to many research, nearly half of the Filipino people do not want to be vaccinated because of the fear of the vaccine, because of safety issues. Many are hesitant to get vaccinated. So what is the role of the church in building public trust and getting our people vaccinated? Ang sinasabi po ng mga research that trust in government, trust in public institutions, and trust in the church is necessary to build trust. The Catholic Church can play a vital role in building confidence in vaccination and ending this pandemic. With this in mind, we, the healthcare workers, implore the church to help us end the COVID-19 pandemic. Hindi po namin kaya sa sarili lang naming kakayahan bilang healthcare workers na i-convince ang nakararaming Pilipino na magpapakuna at hindi rin po namin kayang wakasan ng COVID-19 pandemic without your help. Kaya po natin pinili na magkaroon ng ganitong dialogo at webinar mula sa mga siyentipiko at sa simbahan. Alam ko po na marami tayong katanungan na lumalabas sa ating isip. Ang mga katanungan ng ating mamamayan ay maaaring katanungan din po ng mga bahagi ng ating simbahan. Sa bahagi po na ito ng webinar ay magbibigay po kami ng 7 katanungan na kadalasan tinatanong ng mga mamamayan at susubukan po naming sagutin ito sa paraan na mas mauunawaan na nakakarami. Ang mga sagot po namin ay hindi namin personal na opinion, subalit ito po ay kinuha namin mula sa mga eksperto, mula po sa Department of Health, sa World Health Organization, sa different organizations ng Philippine Medical Association at ng US CDC. Para po sa una nating mga tanong, alam ko po ito po ang tinatanong ng ating maraming mamamayan. Sino-sino po ba ang pwedeng magpapakuna laban sa COVID-19? So gaya po nga ng sinabi ni Dr. Jenny Garcia, lahat po ng mga adults age 16 years old ay baba ay pwede po mag-qualify na magkaroon po ng bakuna. Ang mga bata sa ngayon ay hindi, previous slide please, ay hindi maaaring magpapakuna dahil po wala pa po tayong safety and efficacy trials for children. But right now, across the world, marami na pong clinical trials that are being done to children para po bigyan din po sila ng bakuna sa susunod na mga panahon. Ang mga buntis din po ay maaaring magpapakuna basta po sila ay lumipas na ng first trimester o unang 3 buwan ng pagbubuntis. Sa susunod po nating tanong na sinagot na rin po ni Dr. Jenny Garcia, gusto po ulit nating i-emphasize, sino-sino po ba ang hindi pwedeng bakunahan laban sa COVID-19? Again, inuulit po namin ang mga batang less than 16 years old sa ngayon ay maaaring hindi magpabakuna, ngunit sa mga susunod na panahon ay inaasahan din po natin ang bakuna para sa mga bata. Para sa Pfizer vaccine, ang allergy sa polyethylene glycol at polysorbate ay contraindication sa pagpapakuna at ang severe allergic reaction sa unang dose ng COVID vaccine ay ang absolute contraindication para pagpapakuna. Again, uulitin po natin ang deferral. Ang deferral ay hindi nangangahulugan ng absolute contraindication, ngunit sa panahon na may kondisyon na ito ay hindi maaaring magpapakuna. Ngunit pag nawala na po ang mga kondisyon na ating in-enumerate ay pwede na po magpapakuna. Lahat ng may simptomas ng COVID-19 ay hindi maaaring magpapakuna. Ang lahat na na-expose sa COVID-19 patients ay hindi pwedeng magpapakuna, ngunit makalipas ang incubation or ang quarantine period ay maaari na rin po magpapakuna. Lahat po na nagkaroon ng coronavirus ay hindi maaaring magpapakuna sa unang 3 buwan, ngunit makalipas ang 3 buwan ay maaari na rin po silang magpapakuna. Lahat ng mga buntis in their first trimester ay pwedeng i-defer, ngunit after 3 months ay maaari na pong magpapakuna. Actually, sa Amerika po, marami pong buntis ang nagpapakuna laban sa coronavirus. At ang mga nagpapakuna ng ibang bakuna sa nakaraang 2 linggo ay hindi maaaring magpapakuna, ngunit after 2 weeks sila din po ay pwede na magpapakuna. Again, ika-clarify po namin, lalo na po sa nagtatanong, ang mga may sakit po ay kailangan din pong bakunahan dahil kayo po ang mas high-risk group sa severe coronavirus infection. Ngunit sinasabi po natin na kinakailangan po ng clearance sa inyong mga doktor sa tamang panahon ng pagbabakuna. At doon po sa may mga allergy sa gamot, sa pagkain at may hika, may mga history ng bleeding at may mga gamot na anticoagulants, maaari din po kayong magpabakuna, ngunit may mga special precautions po tayong i-observe para maiwasan ang adverse event sa bakuna. Para po sa ikatlong tanong ng mga mamamayan, ano-ano po ba ang mga side effects sa mga bakuna laban sa COVID-19? Sa ngayon po, petsa March 4, more than 265 million shots of coronavirus vaccine has been given around the world. Sa Amerika, there is already 78.6 million people who has been vaccinated with coronavirus vaccine. Ang CDC po ay naglabas ng talaan ng next slide please. Naglabas na po ang CDC ng United States ng mga na-observe na mga side effects sa bakuna para sa mga pasyente na receive ng vaccine, accounting for 55 million of their population noong nakaraang January to February of this year. So according to the reporting sa US CDC, after the vaccination conducted through February 16, 2021 among 55 million Americans, ang pinaka-common na adverse event sa Pfizer ay headache, fatigue, dizziness o pagkahilo, pyrexia or lagnat at chills. Para naman po sa Moderna, ang pinaka-na-observe na adverse events are headache, pyrexia, chills, pain, and fatigue. No major adverse events were noted among those who were vaccinated. Para naman po sa mga nagtatanong sa mga may allergies, alam ko major concern po natin ito. Anaphylaxis was noted in 4.7 or 5 person per 1 million for the Pfizer vaccine. At para naman po sa Moderna, 2.5 or 3 persons per 1 million ang nagka-anaphylaxis sa vaccine. So, ibig sabihin po, very rare event po talaga ang severe anaphylactic reaction among patients who were given COVID-19 vaccine. Para naman po sa susunod na katanungan, I think this Dr. Jemmy gave a very good discussion. Epektibo po ba ang lahat ng bakuna laban sa COVID-19? Marami pong bakuna ngayon na nasa market ay effective po sa paglaban ng COVID-19. But I know ang maraming concern po dito ay ang pagdidevelop ng variant. Kaya nga po lagi namin sinasabi na sana po ay mabakunahan ng malaking porsyento ng populasyon sa mabilis na panahon para maiwasan po ang pag-mutate ng virus into different variants na hindi na po tatalaban ng mga bakuna. So lagi po nating i-emphasize that napakahalaga ng pagbabakuna sa ngayon at hindi na po natin dapat hintayin ang susunod na mga panahon. Para naman po sa ikalamang katanungan, ito po ang concern ng majority ng ating population. Minadali po ba ang paggawa ng bakuna laban sa COVID-19? Gaya po ng sinabi ni Dr. Jenny kanina, lahat po ng mga bakuna ay dumadaan ng preclinical at clinical phases bago po ito mailabas sa market. So for phase 1 trial, uulitin po natin, ito po ay kinabibilangan ng 20 to 80 participants. So ito po ay safety trial at ang phase 2 ang didetermine ang safety at dosing at ang phase 3 po ay ang safety at efficacy ng ating mga gamot. So lahat po ng bakuna ngayon sa COVID-19 ay nasa phase 3 trial pero gaya nga po ng sabi ni Dr. Ajemi, this has all been proven to be safe and effective for the population. So, alam ko po na tinatanong natin paulit-ulit kung bakit nga ba po mabilis. Una sa lahat, kailangan po natin talaga mabilis na gumawa ng mga bakuna dahil ito po ay napakalaki pong bahagi ng populasyon ng buong mundo ang naapektuhan ng coronavirus. The burden to the governments and to the people around the world makes it a big factor for us to hasten the production of coronavirus vaccine. Ngunit hindi po nangangahulugan na sinakripisyo natin ang kalidad nito. Gusto ko rin po sanang ipakita sa inyo ang video na ito ng Department of Health na nagpapaliwanag kung bakit po ba at paano napabilis ang proseso ng coronavirus vaccine production.
Bakit ang bilis magawa ng bakuna? Bukas na dialogo. Mayroong tuloy-tuloy na pag-uusap sa pagitan ng mga regulatory bodies at maagang nakakapagbigay ng abiso ang mga developers ukol sa kaligtasan at bisa ng bakuna. Focus. Pinagsama-sama ng gobyerno, akademya at mga developer ang kanilang kakayahan upang bigyang pansin ang layuning ito. Pera o resources. Nagkaroon ng incentive ang mga developers dahil may siguradong bibili ng produkto nila kung ito ay nasiguradong iligtas at epektibo.
Okay. So para po naman, sana
Bakit
po
ang
inasagot ng Department of Health ng maayos ang ating mga tanong. At para po sa ika-6 na tanong, at alam po concerned po lahat ito ng gustong magpabakuna para sa coronavirus vaccine. Paano po makakasiguro na ligtas ang pagbabakuna at ano-ano ang pwedeng gawin kung sakali na magkaroon ng side effect ito? So, beforehand po, sinasabi natin no, nagro-roll out na po ang Department of Health na lahat ng babakunahan ay kailangan po na pre-registered muna. Lahat po ng babakunahan ay mag-undergo ng counseling para maunawaan po nila kung ano ang kahalagahan ng bakuna at ang mga potential na side effect nito. Pagkatapos po nito ay magkakaroon din ng screening sa ating mga centers, magpupuntak po ng thorough history taking at physical exam ang mga doktor sa mga vaccination center. At ang pagbabakuna po ay hindi nag-i-end lamang sa act ng pagbabakuna. Magkakaroon din po ng post-monitoring vaccination sa lahat ng mga pasyente na babakunahan. So mahalaga po na sa ating mga mamamayan na maunawaan na hindi lang ito po proseso ng pagbabakuna, ngunit may mga follow-up pa rin po sa mga pasyente na babakunahan. Sa mga pasyente po na lalo na pong concerned sa mga may allergies, after po mabakunahan tayo, next slide please, for the general population, after vaccination, lahat po ng mga pasyente ay mananatili sa vaccination center o obserbahan po for 15 minutes for possible signs of anaphylaxis, allergy, pagkahilo, at ano pa mga adverse events. For those patients with history of allergies and asthma, sila po ay obserbahan for 30 minutes. At pagkatapos lang po ng 30 minutes, ay saka po sila maaaring umalis sa mga vaccination center. And then again, after po ng vaccination period, lahat po ng mga nabakunahan ay ni-encourage na mag-self-monitor at mag-self-reporting. So next slide po. Magkakaroon din po sa bawat health center ng adverse events following immunization kits. Bagamat sinasabi natin na napaka-rare po ng anaphylactic reaction for COVID vaccine, hindi po tayo magiging complacent. Ang bawat vaccination center ay magkakaroon po ng kits to prepare for these adverse events. So magkakaroon po tayo ng epinephrine for those patients na magkakaroon ng anaphylaxis, mga gamot for allergies at steroid, magkakaroon din po ng oxygen supply, intubating set, at magkakaroon din po ng nakahanda na mga ambulansya para madala ang pasyente kung kasakaling kailanganin sa mga pinakamalapit na ospital. And even long before or long after vaccination, kung sakali po talaga magkaroon ng side effects sa bakuna, magkakaroon po tayo ng adverse event following immunization surveillance. So magkakaroon po ang bawat vaccination center ng officer kung sino po na mag-monitor for all those who were vaccinated every 2 weeks for the first 2 months for adverse events. And every month for the next 2 years ay oobserbahan at imo-monitor pa rin po kayo ng ating Department of Health. And again, para po dun sa mga concern na magkaroon po talaga ng adverse events, ay marami po tayong maaaring lapitan para mag-report nito. Next slide, ma'am. So saan po tayo maaaring mag-report just in case we experience adverse events? One, ang lokal po na government unit at ang lokal na health center ay magkakaroon ng COVID-19 Vaccine Safety Surveillance Officer at maaari ding tumawag sa mga call center at maaari din po dumiretso sa FDA through their pharmacovigilance system or diretso po sa mga vaccine manufacturer. Maaari din pong mag-report online to the Department of Health. So again, sinisigurado po ng Department of Health na magiging safe po ang proseso ng pagbabakuna and even after vaccination. At ang Department of Health din po ay bumuo ng NAFIC or a National Adverse Event Following Immunization Committee na mag-iimbestiga sa lahat ng mga adverse events whether this is directly related to the vaccination. So para po sa pagbabakuna na ito na niro-roll out ng Department of Health, sisiguraduhin po natin ang safety para po sa ating lahat ng mga kababayan. So I think these are all the 7 questions na laging tinatanong po sa atin paulit-ulit ng mamamayan. And alam ko po na lahat po tayo ay nag-aalinlangan at natakot magpapakuna. Sana po sa pamamagitan ng webinar na ito ay natanggal po namin or na-alleviate namin po ang ating takot sa pagbabakuna. And paalala po sa atin na alam ko po na takot at nag-aalinlangan Isipin po natin na while we wait for the perfect solution and the perfect vaccine, the poor doesn't have the luxury of time and waiting. Bawat minuto na natatakot po tayo magpabakuna, may isang bata na namamatay sa gutom at may isang ama na nawawala ng hanap buhay at nawawala ng pag-asa sa buhay. Today is not the day to lose hope and to doubt. Ito po ay panahon para maging matapang tayo at manindigan na wakasan ang kahirapan ng ating kapwa at ang pandemya na ito. Love is a gift that gives meaning to our lives. To experience Lent with love means caring for those who suffer or feel abandoned because of the COVID-19 pandemic. And right now, we may have the solution to end the suffering of many. I would like to end this webinar with the words of Christ. Greater love has no one than this, to lay down one's life for one's friend. Walang sino man po ang nabubuhay para sa sarili lamang. Tayong lahat ay pananagutan sa isa't isa at aanhin po natin ang buhay na hindi inalay sa Diyos at bayan. Maraming salamat po.
Maraming salamat, Doc Tina. Ayan po, walang nabubuhay para sa sarili lamang. Komprehensibo po ang ating mga nadinig na presentation, pero marami po tayong nakahandang katanungan. At this point, gusto nating i-accommodate yung mga katanungan ng ating audience. Unahin ko na po ang padalang tanong ni Ms. Elena Belen. Ito daw po bang COVID-19 vaccine ay lifetime ang proteksyon na ibinibigay sa atin laban sa virus?
Can I answer that, ma'am?
Go on, Doc Jemmy.
Okay, so ito pong mga vaccines natin, as we all know, they are still ongoing, yung mga phase 3 clinical trials, and we already have the initial safety and efficacy data, kaya po sila nabigyan ng emergency use authorization. But at this point po, as we speak, hindi pa natin alam kung hanggang gaano katagal yung protection na pinaprovide ng mga vaccine. So siguro sa mga susunod na buwan, when we get more information from the clinical trials, then we will know how long the protection lasts from the vaccine. And we will also know if we need to get a booster vaccine, say for another year, parang yung sa flu, di ba? Every year siya. So sa ngayon, wala pa tayong ganyang recommendation, but we await further data from the clinical trials so we can assess po yung duration of protection.
Maraming salamat, Doc Jemmy. Inaayahan din natin si Doc Tina na kasama natin sa pagsagot sa Q&A. Rex?
Oo, natuwa tayo dun sa sinabi ni Doc Tina. Doc Tina, gusto ko na pong maging kapwa. Dahil sa inyong sinabi. And also we'd like to acknowledge Ate Cecil lang that together with us in our webinar is Bishop Victor Ocampo of Diocese of Gumaca, Quezon. Also Bishop Narciso Abellana of Diocese of Romblon. At magandang umaga din po kay Bishop Oscar Florencio of Military Ordinariate.
Magandang umaga po, Your Excellency.
Dahil dyan, ito po ang aking tanong sa ating dalawang doctors. Marami po sa mga kababayan natin ang nag-aalala dahil mayroon na silang karamdaman. Alam ko po na nasagot nyo ito pero baka meron lang pong hindi nakarinig sa mga nanonood sa atin sa Facebook. So meron silang diabetes, hypertension at iba pang sakit sa puso. COPD, asthma, lahat yata kinuha na nito. Pati maintenance, marami din po sila. Pwede po bang ulitin natin ang ibig sabihin ng medically stable at pwede silang bakunahan?
Sasagot. Actually, gusto po nating i-emphasize for high-risk groups, kayo po ang mas high risk na magkaroon ng severe coronavirus. At actually, mas high risk po din kayo sa mortality or pagkamatay pag hindi po tayo agad na bakunahan. Kaya po ginagawa nga ng gobyerno na tayo po ang priority na mabigyan, yung mga high-risk groups at yung mga senior citizens. So, emphasize po natin kahit may sakit, actually, mas lalo po tayong magpabakuna.
Okay, maraming salamat po. I-accommodate lang natin isang katanungan mula kay Velina Vicaldo. Ano daw po ba ang polysorbate in layman's terms? Ayan. Ito po ba ay related daw sa anong sakit?
Yung PEG muna. PEG is polyethylene glycol.
Yes,
and ang related doon yung isa ding compound na polysorbate. So para silang magkapatid or magpinsan. Chemical compound po sila. At they are contained po kasi sa mga mRNA vaccines katulad nung sa Pfizer. Kaya laging tinatanong, meron ka bang allergy sa PEG? Pero hindi natin alam ano ba talaga yung PEG, saan natin yan nakikita. So it's a common component po ng mga cosmetics, no? Yung mga makeup na ginagamit natin, yung mga skincare products, nakikita rin yan sa mga detergents, no? So kung hindi nyo po alam kung allergic kayo sa PEG, if you have identified a certain product or a certain brand na allergic kayo, say meron kayong ginamit na makeup or pang-apply sa mukha na nag-develop kayo ng allergy, balikan nyo ho yung brand na yon, i-check nyo po yung ingredients dun sa label. Tignan nyo po kung meron doong PEG or polyethylene glycol or polysorbate. Pag meron kayong nabasang ganon, then i-inform nyo po yung magbabakuna sa inyo na meron kayong allergy sa ganitong brand ng cosmetic or sa ganitong brand ng skincare product at nakita nyo meron yung PEG. Kasi baka hindi kayo eligible para ho dun sa mRNA or sa Pfizer vaccine, then you will receive an alternative. So hindi ko kasi, I don't have the comprehensive list kung ano yung may PEG talaga. I know certain brands but I don't want to mention. So the simple thing to do is kung meron kang alam na allergy mo in the past, go back to the brand and check po kung ano ang laman nun, kung may PEG. Yun po ang aking mapapayo sa kanila.
Actually, Bob, yung PEG is a very common laxative. So marami na pong gumagamit yan worldwide at napaka-rare din po ng allergy dyan. Minsan ginagamit din po yan sa mga dairy creamers. So sa mga food po, marami din pong PEG na kasama. So tama po si Doc Jenny. So kung may na-identify kayo, pagkain, produkto na may allergy kayo, check nyo kung may PEG. Pero napakadalang din po ng allergy dyan.
Salamat, Doc. Pagsamahin ko po ang tanong ni Esther Cruz at saka ni Marilo de Quinia. Libre po ba ang bakuna? Maging sa mga nagtatrabaho sa pribadong kumpanya at galing kay Ms. Marilo is kasama ba ang PWD sa mga mababakunahan?
Okay. The question is kung libre, no? Tama.
Yes.
So ngayon po kasi under tayo sa DOH program. So it is really given for free. Kasi nga wala pa ho silang marketing authorization. So meaning hindi siya commercially available. So ang gobyerno ang bumibili para sa atin and they are giving it to us for free. Yung mga persons with disability, yes, by all means, you can get vaccinated because you may be part actually of the priority group. So kung kunyari, naging bedridden because of a previous stroke or certain condition, no, like disability from diabetic foot infection na na-amputate, part kayo ng priority group for vaccination. So therefore, you can still get vaccinated.
Okay. Wala naman kay Pilar Valdez. Ano daw po bang tipo ng vaccine? Which type of vaccine ang pinakaligtas? mRNA, spike protein, dead virus. Maraming salamat daw po.
Okay, so in terms of lesser adverse effects, it would be the inactivated virus kasi matagal na huyan natin ginagamit, no? It's a known technology na for developing vaccines. But if you receive a certain vaccine, iba-iba naman ho kasi yung mga eligible groups, no, for different vaccines. So kung eligible ka sa isang bakuna, i-check mo lang rin kung ano yung mga contraindications so that you know kung pasok ka doon, no? Generally naman pare-pareho lang po yung mga common adverse events niya, no? Yung local reaction, no, pain, redness, swelling, tapos yung mga systemic reactions ay yung headache, no, fever, fatigue. So halos pare-pareho naman po sila except for certain mga special events like for example yung mga na-mention po na anaphylaxis dun sa Pfizer vaccine. So generally, as I mentioned in the summary slide, generally all the vaccines right now are safe and well tolerated naman yung mga mild adverse reactions.
Para dagdagan ko po yung sinabi ni Doc Jenny, no? Kaya nga po tayo meron pick yung Adverse Event Following Immunization Committee. At ini-encourage yung self-reporting para makita natin na kung sa general population na po binigay ang bakuna, ano po ba yung safety profile talaga? Iba po kasi ang safety at adverse events in controlled trials versus pag in-apply nyo na po ito sa general population. So, kaya napakahalaga na ini-encourage natin yung mga mamamayan na after vaccination, mag-self-reporting pa rin po tayo sa Department of Health. So, pero we're praying that every body stays safe after vaccination kasi ako po isang bakunador mula nung decades ago, and among my patients who were given vaccine, different types of vaccine, wala naman po ako nakitang adverse events. And I hope this is also true for the COVID-19 vaccine.
Doc Tina, Doc Jemmy, may mga natatakot pa rin kasi na magpabakuna. Sabi nila, pwede bang uminom na kami ng anti-allergy bago kami magpabakuna? Parang nagsisigurado lang. Okay lang po ba yon?
Okay. So, sasagutin po natin yan. No? Sabi nga po na Philippine Society of Allergy and Immunology, hindi po ini-encourage ang mag-inom o uminom ng anti-allergy before vaccination. Lalo na po yung antihistamine, yung cetirizine, loratadine na very popular kasi it can mask anaphylactic reaction. So, hindi po dapat na iinom yan. At the same time, meron din po tayong steroids. So, hindi rin po dapat uminom ng steroids before vaccination kasi po yung immune response natin will be blunted pag uminom po tayo ng steroids when taking the vaccine. So, hindi po natin ini-encourage yan. Saka handa naman po yung ating mga centers to respond to any anaphylactic reactions.
Okay, maraming salamat po, Doc Jemmy and Doc Tina. Awat po muna tayo sandali lamang dahil meron pa po tayong dalawang speaker na naka-line up. Ayan. Una po, para bigyan tayo ng impormasyon sa deployment ng mga bakuna on the national level naman. Makakasama natin mula sa Department of Health, ang chairman ng National COVID-19 Vaccine Operations Center, si Yusek Mirna Kabutahe. Magandang umaga po.
Morning. Do I make a presentation? Some of the presentations na nasabi na kanina. I go on with the presentation or question and answer?
Go ahead, Yusek.
Okay. Magandang umaga po sa inyong lahat. Salamat po sa pagkakataong ito na maipamahagi natin kung ano po yung ating National Deployment and Vaccination Plan. Nasa Secretariat na po yung ating presentation. So can I have the slide? But overall, alam po natin na ang trust, next slide please, ng ating pagbabakuna ay whole of government, whole of nation approach. No? It will be led by the national government with some guidance and policies. Ang talagang mag-i-implement ng programa ang ating mga local government units. No? Sila po sa kanila po naka-base yung ating pagbabakuna. And all of us have a special part to play as advocates, as part of those who are going to report, tapos yung mga mababakunahan, so that all of us will have synchronized and integrated efforts. Next slide, please. And this is the first massive immunization program nationwide. Next slide, please. Sinisigurado po ng DOH ang kanyang pagiging safe, equitable, and cost-effective. Yan po kasi ang ating vision na for all Filipinos, ang target po natin sana ay 2023. We would like to have all of this available by this year, 2021. Alam po naman natin, hindi po sigurado yung supply ng vaccine. No? While we are trying to secure or lock in several vaccines. May portfolio ho kasi wala namang pong isang manufacturer ang mag-supply ng kailangan natin ng 50 to 70 million Filipinos. Kagaya ng nasabi kanina, hindi pa ho sigurado kung kailangan natin ng second dose. So we're looking at 2023 na sana mabakunahan na po at least yung mga eligible population para ho maprotektahan natin ang ating public. We prevent cases and we prevent deaths. Next slide, please. So the DOH assures you that its objectives are provision of equitable access, no, to COVID-19 services to priority groups. There is enough supply. And kasama po kayo sa pagtulong sa amin to increase the demand for vaccination services. I'm happy with Dr. Jemeline kanina na bakunado na siya because she's one of the priority groups that have been immunized, and we want to ensure safety in the program and provide support So wag po kayong mag-aalala. If there are cases of adverse event, the government will provide the support for you. Pero nasabi na rin, the adverse events are really very rare. Next slide, please. So meron tayong National Deployment and Vaccination Plan. This is available to the public at the DOH website. Ito po, sinasaad yung ating end-to-end na plano. So pagsimula po na paano tayo nag-evaluate ng vaccine, ano po yung basis, paano po tayo nagsiselect, paano po tayo nag-access at paano po tayo bumibili ng mga vaccine. Meron pong mga chapters yan as part of our transparency, saan po nanggagaling yung pera na ibibili sa vaccine, paano po mag-ship, paano po tayo distribute at paano natin nag-administer, tapos paano po yung kampanya natin, and then how do we assess and monitor. And cross-cutting, meron tayong special chapters, ano pa yung kailangan governance structure, paano po yung data management, tapos paano po yung risk communication and demand generation. Next slide, please. Ito po, importante yung shipments and storage. Kaya nakailang practice din ho tayo pagdating ng vaccine, galing sa airport, pagpunta po sa warehouse, tapos pag-distribute sa ating mga vaccination centers. Kasi gusto po natin, ang ating bakuna ay effective. Hanggang dumating siya sa ibabakuna niyan. And we can only do that but by ensuring that it has cold chain management. Ibig sabihin, kung kailangan natin ng -70 to -80, preserve yan hanggang dumating sa ibabakunahan. Kung +2 to +8, yun po yung mga temperatures na mini-maintain magmula sa manufacturer hanggang sa ini-store natin. Ngayon, nabalitaan nyo naman, nasa Metro Park tayo sa Marikina. Tapos, dinidistribute natin yan sa ating mga ospital. And then now, we are starting to distribute to the different regions. Next slide, please. So, ang ating overall principle ay that COVID-19 vaccines are a global public good. Tsaka nasabi niya rin kanina, it is free for all Filipinos po. Except yung mga nababalitaan yung may tripartite arrangement with the local government. Yung local government din po ang naglalabas ng pera. Yung quadripartite or tripartite with our business sector, sila po ang naglalabas din ng pera to buy the vaccine. Pero dapat po hindi charge sa ating mga mamamayan. No? And our principles are reciprocity. Importante po yan kasi kaya po nag-prioritize tayo ng health worker kasi sila ang most at risk. Kaya sila po ang unang mabibigyan ng bakuna. So in terms of the prioritization, in the next slide, ang una po ay workers in the frontline health services. So ang workers in the frontline health services may mga sub-priority. Based on the available vaccine hanggang sa sub-priority 2 pa lang tayo po. Nag-start tayo sa mga COVID referral. Ngayon po nasa COVID hospitals catering to our COVID-19 patients. Susunod na po yung mga TPMFs, tapos yung mga irimang hospital, yung mga ating RHU, tapos yung ating mga jails, yung ating mga orphanages, yung ating mga nursing homes. No? So ang isang tanong po, sa inyo na nakikinig sa atin, saan ba ako kategory? Kung hindi ka po worker sa frontline service, kasama po pag nagbo-volunteer ka sa TTMF, pag ikaw po ay nasa nursing home at nag-aalaga ng mga lola natin doon, kasama po kayo sa frontline. Kaya lang, medyo mahuhuli ang bigay natin. Kung kayo po ay senior citizen, kasama kayo sa priority. Ito po yung persons with comorbidities. Ito po yung mga sakit na sabi na kanina. Ang mga priority po ay yung may mga sakit. Pero kailangan lang clear muna ng doktor nila. Yung discuss na natin who are medically stable. We assess them, we screen them. Pwedeng i-defer ng konti, depende kung hindi pa sila pwedeng makuha. But eventually, pag nag-go na yung doktor nila, yung mga attending physician, they can receive the vaccine. And then, we are now defining our frontline personnel in essential sectors, tapos yung ating indigent population. So most of us are in priority group B, no? Government workers, teachers, social workers, ang ating mga essential workers outside of the health, social, and education sectors. Tapos na mention kanina, yung ating mga person with disabilities, tapos yung ating mga persons deprived of liberty. Susunod, mababakunahan po lahat ng Pilipino, depende sa kailan po dadating at saka yung amount. Pina-prioritize po lang natin. The next slide will show us bakit po natin meron tayong sectoral prioritization, no? Ito po yung sinabi ko kanina. Ang susunod pa ho, yung geographic prioritization. Inuna po natin ang CR kasi po siya po ang pinakamaraming kaso. So importante yan, kung saan mas maraming kaso, pero mas marami tayong ibibigay. Pero in terms of equity naman po, directive ni Pangulong Duterte, nagbigay na po tayo ng at least all over the Philippines, yung ating mga priority hospitals na nag-admit po ng mga COVID. So we are starting the distribution po sa iba-ibang regions yesterday and today. Tapos ito po yung exposure natin, bakit po mauna yung third level, bakit inuna natin yung mga DOH hospital, pati yung mga private hospital na third level. Kasi karaniwan, sa kanila ho pumupunta yung mga serious cases. Tapos yung senior, o mas matanda, mas priority po yan. Next slide po. Ito po yung tinatawag natin cold storage. Nasabi ko na kanina. So depende sa iba-ibang klase ng storage ng vaccine. Meron pong +2 to +8, meron pong -20 at -70. So habang po binibigay natin hanggang makarating sa babakunahan, we ensure that there is a system and that the system is monitored para po safe and effective yung vaccine. As a general rule, from the vaccine supplier, nakita nyo naman po sa video, galing ng ano yung tawag dyan, China, galing sa arrival, pumunta sa Metropac. This afternoon, we're going to receive the AstraZeneca. So, i-receive din yan, tapos pupunta sa ating warehouse, tapos i-distribute. May special handling lang po yung 70 degrees. So, sa vaccine distributor, yun po yung unang pre-practice namin, yung Pfizer. Pagdating ng Pfizer, -70 to -80. Hindi na po dadaan yan sa regional warehouses. Diretso na po sa mga ospital na merong capability ng -70 to -80 degrees centigrade na mga refrigerator. So ang susunod na slide, na-share na po ito kanina, meron po tinatawag na pre-implementation. So nag-practice na po yung ating mga RHU. Nag-identify po tayo kung ano yung mga vaccine. Nasabi na rin na iba-ibang vaccine, iba-iba po yung mga indication. But as a general rule, nasabi na rin kanina, hindi ho babakunahan yung below 18 years old. May mga vaccine na hindi ho pwede sa senior citizen. No? So, ang importante dito, makikita natin our vaccine expert panel and our NITAG are looking at kanino appropriate yung vaccine na dumating. So pag dumating ang Sinovac, meron po tayong guidelines diyan. Pagdating ng Astra, meron din po tayong guidelines. Tapos nag-identify na po tayo ng mga vaccination areas, nag-master list na tayo. Tapos ngayon po nag-allocate tayo. Alam ko madugo itong allocation kasi lahat po gusto maging priority. But if we follow certain priority and equity, alam kong hindi tayo malilihis ng landas. Paghihintay lang po yung iba kasi hindi pa sila priority at kulang po ang ating stock. Kung ano lang po yung dumating, yun po ang ina-allocate natin based on principles of equity reciprocity. So, tapos po may implementation activities tayo pag nag-administer na tayo. Tapos itong importante, mention na rin yan ni Doc Tina, na we do surveillance immediately after the vaccination and even 1 to 2 years after para makita ano ba yung epekto ng bakuna. So in terms of nationwide vaccination, nag-master list po. Alam ko ang tanong nyo, paano kayo mag-master list? Kung nasaan po kayong local government unit, preferably doon po kayo mag-master list. Kung kayo ay mga kasama sa kumpanya, pwede rin kayong workplace kung saan kayo mag-master list. Tapos may mga forms naman tayo, may mga systems. And then nagpaplano po, ang talagang in charge dito yung mga local government units. So tinitingnan nila kung paano magbigay ng mga bakuna. Except for now, ang ating focus ay mga hospital. So diretso na sa ospital ang mga ngayon. Ang mga distribution ng supplies ngayon. And then importante po yung ating vaccination workforce. So kayo, you can volunteer sa local government units, sa mga ospital. Ano ba ang pwede nyong gawin? Vaccinator kayo, pwede kayong counselor, pwede naman kayong taga-baton. Diba? Kailangan natin ng mag-check sa vaccination site kung ano yun, prina-practice at minimum public standards. Ito po yung pwede nyong salihan, no? As educator, tapos ito yung documentor, tapos sa vaccination team, meron tayong screening by the physician, nurse, and midwives. Tapos meron tayong adverse event composite team para makita kung ano yung mga side effects na nararamdaman ng ating mga vaccinee. And then, ito po, kailangan natin yung cold chain officers, yung mga security, driver, tapos social mobilizers, hindi lang po PHW. Kasama din po kayong nakikinig sa atin ngayon na para ma-influence, para masabihan yung ating mga naka-schedule na magbakuna na pumunta na sa bakuna center. Next slide, please. So ito na yung sinabi kanina ni Doc Tina, meron tayong registration, may sistema. Tapos po pag ini-screen kayo, may pre-screening kung kayo ay ano yung mga nararamdaman nyo para may apiso naman kayo, tapos ini-schedule kayo. But on the day of the vaccination itself, titignan din kung may mga nararamdaman kayo at the moment na baka i-defer yung pagbabakuna. And then we do the vaccination, and then this is the new thing in the vaccination. Dati-dati, pag tapos na tayong magbakuna, umuwi na tayo. Sinabi din ni Doc Tina ngayon, 15 minutes to 30 minutes, maghintay muna po yung nabakunahan para makita kung may mga adverse events. Pero kahit na po umuwi na kayo, bibigyan po kayo ng number na pwede niyong tawagan kung sakaling nasa bahay na kayo at may maramdaman kayo. Even after 1 or 2 years, meron po kayong mga hotlines na pwedeng makontak. Kung naka-QR code na kayo, nakatag na kayo, pag punta nyo sa ospital, makikita po kung related sa bakuna ito o hindi. So in terms of our vaccination implementing units, this is of importance and ano yung concern ng ating mga nakikinig na participants ngayon. Ito po yung mga pwedeng gawin. Establishments authorized to conduct the vaccination activity, nakalista po yan. Tapos you can have several vaccination sites na nakakabit po sa vaccination implementing units. So ano po yung mga vaccination sites where the vaccination can be done? So alam ko na na-contact na po kayo ng ibang mga lokal na pamahalaan that you can use the churches kasi mas maluwag sila, yung mga social halls, mga schools. Pwede ho yan vaccination post. Pero kailangan po nakakabit kayo sa implementing units ng local government units sa ospital para mas maganda po yung referral tapos yung mga cold chain. So the next slide just tells us kaya po kailangan na medyo malaking space. So we need your na-offer na po yung ating mga churches, yung ating mga schools na pwede pong gamitin vaccination sites kasi po may waiting area. Alam naman natin nasa pandemic pa tayo, kaya kailangan social distancing, yung bida, bawal walang mask, mag-sanitize, and then may mga post tayo yan sa registration hanggang mapakunahan. And then we have a post-vaccination area where we observe for 15 to 30 minutes. Dapat naka-ready na yung ambulansya. Naka-ready na rin kung saan ospital dalhin yan kung sakaling may serious adverse event. So this is has been also explained earlier by Doc Tina. Meron tayong proseso paano mag-report ng adverse event. Tapos paano po natin ina-assess. Be rest assured that kung may naramdaman kayo, immediately at the vaccination site, they will respond. And then kung private man or government hospital ang pupuntahan nyo, you can be taken care of by the local government unit, by the national government through the PhilHealth packages. Ngayon po, bumubuo tayo ng IRR kasi meron tayong COVID-19 Vaccination Program Act na nagpro-provide po sa PhilHealth na mag-aral ng adverse event package. Ngayon wala pa tayong adverse event package for immunization. Kung allergy, anaphylaxis ang complaint nyo, may package tayo for anaphylaxis. Kung may mga iba kayo nararamdaman, may specific package din yun. Pero gagawin po ng PhilHealth ngayon, based on bagong batas na kapipirma lang, there's now a package for adverse event. Tapos may kulatilla po doon, providing protection to the vaccinator. Tapos po yung mga mababakunahan, kasi naman informed consent yan, kung may mangyari sa kanila, may tulong po ang gobyerno kung ito ay directly sa vaccine. Unless may ginawa naman po yung vaccinee, no? And unless din pwede nating i-charge yan sa manufacturer if it is willful and yung talagang negligence ng ating mga supply manufacturer. So meron po tayong at different levels ina-assess kung coincidental o cause yan. At the national level, meron po tayong governance structure para makita kung paano po yung pag-decision ng paano po nag-obtain, paano po nagdi-distribute ng vaccine. So we are under the vaccine cluster. Next slide, please. So ngayon, nag-establish na po kasi nagro-roll out na yung ating tinatawag na Vaccination Operations Center. Meron po dito tayo sa national, nandito kami sa Camp Aguinaldo. Sa Regional Vaccination Operations Center, meron din yan para yung mga issues ng distribution, yung mga planning ng distribution, yung mga social marketing, yung mga communication, nakalatag lahat yan. Hanggang sa local na pamahalaan, meron po tayong Vaccination Operations Center. And then, if you are master listed, you have a QR code. Kung sakaling nagbag na, pwede na mano-mano. Pero pag nagbakuna kayo, bibigyan po kayo ng vaccination card. Tapos po, lalagay doon kung ano yung lot number at saka ano yung vaccine na binigay sa atin para i-remind din kayo that you come for your second dose. Maiba po ang interval. For Sinovac, it's 28 days. For AstraZeneca, 21 days. No? So may reminder kayo na kailangan kayong bumalik. Hindi po pwedeng pag-mix yung mga vaccine kasi hindi natin alam yung adverse event. Tapos ito po yung ating last slide. Kailangan po natin ng risk communication. Importante yung community engagement kaya we are very happy with this webinar. You are all here to know what is the correct information and then kasama po namin kayo multipliers para po ma-engage natin yung mga community, makabigay tayo ng tama at sapat na information. And I think one of the new things now that we are appreciative of the Health Promotion Bureau, we are now tinatawag na listening. So while we are giving you some information, we are listening also to your complaints, we are listening to your reactions, we are listening to your suggestions. So yan lang po, sama-sama tayo. Next slide, these are the demand generation playbook that you can look at and the standard templates and collaterals that are available in these links. And finally, pagsama-sama po tayo, ito po yung ating tagline, Res Bakuna, kasangga ng bida, sama-sama tayo sa bida vaccination. So we are counting on your help and support. Maraming salamat po.
Maraming salamat po, Yusek Mirna Kabutahe. Ngayon naman po, maari pa rin po kayong magpadala ng inyong mga katanungan para po dun sa, sabi nga ni Yusek Mirna, yung ating mga multipliers na audience, no? Maari pa po kayong magpadala ng inyong mga katanungan sa ating Q&A box. Ngayon naman po, mula sa national level, pupunta naman tayo ng local government. gusto po namin makita ninyo ano po ang ginagawang paghahanda ng ating lokal na pamahalaan. Baka po kasi merong mga gaps or mga oportunidad na maaari po ninyong matulungan ng ating mga local government units. Kasama po natin ngayon mula sa City Health Office ng Davao, si Dr. Aldrich So. Magandang umaga, sir.
Magandang umaga. Pleasant morning to everyone and also to our distinguished guests and our virtual audience for this morning. So once again, I am a representative of the City Health Office of Davao City. I will be presenting our vaccination plan in lieu of our City Health Officer, Dr. Ashley Lopez. So allow me to share my screen. So I guess I will have the shortest presentation among all the presenters because basically I will just be giving you an overview of what's happening in Davao City. And it will just mirror, probably more or less mirror what Yusek Kabutahe had presented because that was the national plan. And here I'm presenting what we're doing locally. So more or less it is the same. It will just vary on how we implemented it. So to start off, we appreciate very much the support of our local government because at the start of this year, an operation center for the vaccination was created. So there was an executive order from our local government. So at the start of 2020, we actually had Operations Center A. That was the response cluster. So this was basically centered on our response to COVID-19. So this includes contact tracing, isolation, and management of our COVID-19 cases. So this year, there is a restructuring done, a restructuring of our organizational structure. So there is now Operations Center B and C in Davao City. So specific to the vaccine would be Operations Center B. So this is totally new organizational structure made for this year, specific for our vaccine plan, our vaccination program. So this is just the specifics. So as you can see, it is not only us, the City Health Office, involved in this vaccination. We have included other agencies in our city. So for different responsibilities and roles with the vaccination. So we started off by giving trainings. Our trainings was a challenge because we are limited by our situation right now to online trainings. So we were able to do the following trainings mentioned here in the slide. So as mentioned, this is actually the same concept with what Yusek mentioned earlier. We also followed the priority group. For priority groupings, this is recommended internationally and nationally. This is the master listing po. So we follow this certain order po on who will receive the vaccines first. So we had initial count. So these are our initial numbers for our priority A in Davao City. So this was also mentioned earlier, so I won't have to elaborate on this one. But for the first priority, we have sub-priorities because due to the limited supply of vaccines coming, we have to know which groups will be coming first. So it was already emphasized earlier that our COVID-19 referral hospitals will be receiving the doses of the vaccine first. So again, we have already assembled our vaccination teams. So for everyone's information, Davao City is composed of 3 congressional districts composed of 18 health districts. So what we did was we met with the district health officers. So these are the physicians holding each health district. And they have assembled their own vaccination teams per district po. So this is just following yung national guidelines. So for initial rollout, so this week, tomorrow pala, we are already planning on starting the initial rollout in Southern Philippines Medical Center. And then it will follow the next vaccination site, which is a school, the A. Mabini Elementary School, will follow on Monday. So these were our initial sites. So itong sites na po ito are already ready to operate po. And we have done simulations already during the previous month. And also, just last February 16, the code team, the national code team with Secretary Galvez has also visited these sites and has approved of them po. So we have, for those audience po natin who are from Davao or familiar, we're still planning to open these sites. We still have ongoing communications with them. So we have several sites. So as I've mentioned, we have 18 health districts. So we have assigned which health districts po yung from each vaccination site. So this one is the same concept presented earlier. It's just a floor plan, but maybe you can appreciate later. I have actual photos po ng aming initial site, yung A Mabini Elementary School. So it's just a run through that we have a waiting area, a registration, a counseling area, screening, vaccination, and then the post-vaccination area. So I will just next be presenting photos of our actual simulation. So we had several simulation activities already. We had several with the airport, with the transport of the vaccine, and we also had on-site. So we had one on February 12, and the other was February 16 with the presence of our national code team. So this is our waiting area, typical image of a school gym. So we had to make sure that the vaccinees who are coming are spaced farther. So we still follow the basic protocol that we have with with our COVID-19 protocol. So this one is the hallway directly adjacent po to the gym. So the vaccinees, they'll be called by groups of 4 because this school had set 4 vaccination teams. So there are 4 stations there are 4 teams positioned in each station. So for the first station, we have our registration area. In this site specifically, we have put up already our printers, computers, and internet connection. So the original plan was to have the online registration because we have an online system po, developed by our national government. However, for our initial rollout, we also have a contingency plan just in case there will be power outage or we cannot access the files online. So we also have a contingency plan to do it manually. So this is how it looks like. So the previous picture was on the 12th, and this one is on the 16th. We have already placed our acrylic barriers for our registration personnel. So the next area is the counseling area. So again, another four individuals here. So in this area, the final consent will be signed. So we have received the necessary materials already from DOH. What information needs to be communicated to our vaccinees before they will give their consent to vaccination. So at any time po, our vaccinees can refuse during this phase. They may not sign their consent if they do not want to proceed with the vaccination. So this is how it looks. Still again with the acrylic barriers, and our personnel are having their mask and face shield po. So this one is the screening area. This is where the vital signs are taken and pertinent history is being checked. So here, each vaccinee's eligibility is being checked. For example, we're looking into the patient's history, comorbidities, if the patient is stable, and so on. So one physician is assigned here to check into our patients na meron pong mga kalagayan or merong any concerns po. And here po, the physician may defer you. Ibig sabihin, if he or she sees that you're not fit to proceed with the vaccination, you may be deferred po or maybe further assessment may be needed bago po kayo bigyan ng vaccination. So this is how it looks like. Our staff here are on their PPE for their safety din po. So the actual vaccination area is located just to the room next to this. By the way, lahat po ng stations natin, they're just adjacent po. There are several rooms po dito sa ground floor and they are just adjacent to one another. So we have transferred po ang aming refrigerator dito sa site. So this is from the district. So as mentioned earlier, when we use a school as a vaccination site, it has to be tied up with the local government. So ito po, this is specifically the health district of Talomo South. So they tied up with this school, the A Mabini Elementary School. So that is why yung logistics po nito, it is a shared effort. So whatever anong kulang ng school, the local government or the health center will augment. So itong refrigerator was taken out doon sa health center po namin. It's not seen dito sa image, but we also have a power generator po, just in case there will be a power outage. So we need to protect po yung vaccines that we have. And the last site would be our post-vaccination area. So again, it is just adjacent doon sa ating vaccination area. So again, we have medical personnel here who are monitoring our patients. So as mentioned earlier, if you are in the general population with no allergies or nothing na bantayan, you can stay as long as 15 minutes here to be monitored. However, those with histories of allergies or those deemed by our physician to be monitored closely will have 30 minutes and even more. It would depend. So outside of our, so this is how it looks like pala. So we have beds here and then another room because we anticipated that this room will be the one na saan matagal magstay yung ating vaccinees. So we have prepared additional rooms beside and above dito na room na ito with chairs and also folding beds just in case. So here is a sample of our post-vaccination area with chairs for those who are able. Then right outside this room, we have standby ambulance. So this was provided by our Central 911 in Davao City. So we have already talked to our AAFI referral hospital, which is the Davao Adventist Hospital. It's just 5 minutes distance from this school. So it is a very good, it is ideal po yung hospital na yun to be the referral hospital. You can just even walk there. But our ambulance will transfer our patients going there if ever there is a serious case of adverse effect po na ating vaccines. Na hopefully wala naman po. So I guess that's the end of my presentation. So thank you very much.
Dagang salamat Dr. Aldrich So sa pagpapakita sa amin. Mukhang handang-handa na yung Davao City, Ate Cecil. And para po sa part 2 ng ating kwentuhan, tatawagin po natin. Of course, si Dr. Aldrich So should remain. Tawagin din natin si Yusek Mirna Kabotahe at si Dr. Tato Quizon from DOH para po sa kwentuhan pa ng malaliman ukol sa mga paghahandang ginagawa ng DOH at ng ating local government unit.
Ayan, unahin na natin yung katanungan ni Roy Havilla. Mukhang he is representing yung mga kabataan. Sabi niya, with the fear among Filipinos when we talk about COVID vaccine. Paano po kami bilang mga kabataan makakatulong sa aming komunidad upang mapagtibay pa ang idea ng pagbabakuna?
Maybe I'll take this question po, no?
Go ahead,
I emphasize the Department of Health. It's not just about getting yourself vaccinated or your family vaccinated. It's about getting your entire community, your friends, your family, your region to get vaccinated. Words have power. Even the youth have power. Parang based on a Pulse Asia survey done in 2018 in terms of when asked kung sino ba ang may impluwensya para ikaw ay makakuha ng bakuna, ang sinagot ng mga tao, ang number 1 ay usually Department of Health, number 2 ay healthcare workers, pero in number 3 and number 4, lumalabas yung impluwensya ng family and friends in terms of making the decision to get vaccinated. So, hindi porket bata ka, wala kang impluwensya. You can influence change. And dapat hindi lang siya within your family, it should also be in your community.
Ayan, maraming salamat po. Si Dr. Tato Quizon po ay bahagi po ng ating esteemed panelist at siya po ang Medical Officer 4 ng Department of Health.
Ramdam na ramdam ko yung sinabi ni Dr. Tato. You are definitely not too young to lead. Kahit bata ka, meron kang kontribusyon even sa mga simbahan. Gusto kong tanungin pa rin po, ano po yung mga specific na dahilan kung bakit may challenges ang enlistment ng priority sectors katulad ng healthcare workers, seniors, indigents, yung mga may comorbidities po. Ito po ay common question po sa mga usapan tungkol sa pagbabakuna. Anyone
Maybe we'll start with Aldrich. Ano yung mga problema nyo sa pag-master list, please?
Yes po. So definitely po, I think it's common all around our country that there is a vaccine hesitancy. So ano ba yung challenges that we had when we first introduced it this year? The vaccine will be coming. It's natural that we have some who have negative reactions to this one. So, a lot of people actually would not want to get vaccinated because of some sort of fear. So the main problem we've identified dito is actually misinformation po. That's number 1. Because right now, when the pandemic started, we are confined to our homes, so we're much more engrossed sa social media, to the internet. And this may be both good and bad. Yung negative side effect po nito was a lot of misinformation is spreading. So hindi pa nakarating yung vaccine sa atin. We already receiving a lot of false information about these vaccines. So this will be the one to spread yung fear po sa ating family, even sa ating youth. So that is one main challenge. However, we noticed that when we started rolling out some of our campaign for the vaccination, we had some town hall sessions conducted by our hospitals, by our medical associations. Nag-shed po ng light sa ating mga people. And some of them who were hesitant at first were finally convinced na magpa-vaccinate na po sila. So, yun lang po.
Maraming salamat po, Dr. Aldrich. So, nais lamang po natin banggitin, meron po tayong mga katanungan na tatanggap like ano po ba ang magiging hakbang ng ating mga simbahan para maipalaganap ang mga impormasyon na kagaya ng binabahagi po natin. Ang ating pong webinar ay simula lamang po ng ating mga gagawing pagtutulungan para po makasama natin ang ating gobyerno at iba po nating mga leader pa para po mas malaman natin kung ano yung mga gagawin. So sa mga susunod pong araw, mga susunod na linggo at buwan, ay makakaasa po kayo ng mas marami pang impormasyon.
Miss Cecil, may I just add, while ang trend ngayon ay ganito, Zoom,
yes,
wala pong tatalo sa face-to-face. So I think that is the advantage ng ating mga parishes, that they can do some face-to-face explanation. Question and answer po yan para mas naiintindihan natin. So sana kung alam ng mga nag-preach o kung sino man yung mga ministry ninyo, and then they can do some face-to-face, kagaya ng mga senior citizen. Pag tinanong mo magpapabakuna, hindi. Unang sasagutin yan, hindi. Kasi hindi pa nila alam. So, pero kung na-explain mo na, eto po, kasi magtatanong sila pwede ba sa akin? Kagaya ng mga tinanong dito, ako ay may sakit. I mean, we cannot answer that individually. Alam naman natin yung mga kagaya kong senior citizen, hindi ko pwedeng magganito. BTC, mga social media, importante pa rin yung face-to-face communication. Salamat po. For possible.
Sa akin, Ms. Cecil, I think napaka-vital po ng role ng church para ma-advocate ng vaccination sa mga mamamayan. Kasi alam po natin na the church always has the best interest of the people in mind. Alam ng taong bayan yan, na ang church ang pangangalagaan ng kanilang kabutihan. So I think if the church speaks to them, mas mauunawaan nila na hindi interest ng mga drug companies or ng gobyerno ang kanilang binibigay sa mga tao, kundi sa interest ng mga mamamayan. So I think the church will really vital para tapusin ang pandemic na ito.
Ayan, follow-up question lamang po. Maraming salamat, Dr. Tina. Yun daw po bang sa sustainability ng mga bakuna? Ngayon pong taon ay libre po ito. Paano po yung mga susunod na taon?
Meron pong pondo na binigay ngayon for the vaccination. Habang po ito ay emergency use authorization, the government will be responsible. Although nakikipagtulungan na po yung lokal na pamahalaan, kagaya ng sinabi ko, at saka yung ating mga business sector, pero pinapadaan sa DOH. In the future, sisiguraduhin po ng DOH na mailagay yan sa budget ng kagawaran ng kalusugan as far possible kung sino yung mga priority. Ganyan lang po naman ang binibigay natin sa mga National Immunization Program, yung mga measles, yung mga polio, yung iba-ibang vaccine. We have been giving it free for the past how many years. So kailangan lang, depende sa budget, kung sino yung priority. For example, yung ating flu vaccine at saka yung ating pneumococcal vaccine, they're buying it sa Department of Health, pero ang ginawa nating priority, yung mga senior citizens. So may mga ganun po na pamantayan, but be rest assured that as far possible, DOH will endeavor to have all of this in our budgets para maibigay ng libre sa ating mga mamamayan. The coming and after 2021, 2022.
Maraming salamat, Yusek Mirna. Yes, Dr. Tina?
Siguro natin po nasa private sector at saka nasa church, siguro sa susunod po panahon expected po natin na ibang segment ng population siguro po bibilhin na po ang bakuna kasi hindi naman po siguro magiging sustainable na forever ang government ang magbibigay. Siguro sa atin po ang responsibility natin na magbigay po tayo ng konsensya sa ating mga drug companies that they sell in the future this life-saving vaccine sa ethically priced na kakayanin ng lahat ng mamamayan. So I think that is the responsibility of the people and the church to ensure that we give or we conscientize the private drug companies.
Thank you, Doc Tina, dun sa iyong response. And also, Doc Jemmy Garcia is actually answering some of the questions posted dito sa ating Q&A box. Maraming salamat, Doc Jemmy. Para po sa members ng ating panel, yung mga volunteers po ng simbahan, tulad ng mga social action center members, pwede rin po ba silang mabakunahan ng lokal na pamahalaan? I believe some of those attendees here in Zoom and those who are watching in Facebook are actually members of the social action centers ng ating mga simbahan.
Ako po ang sasagot niyan. Depende po sa priority. Kung mga social action officer at sila po ang tumutulong sa ating temporary treatment monitoring facilities, yung ating mga isolation centers, tumutulong sila sa ating mga nagko-contact tracing, tumutulong sila sa mga nagsuswab, at pa-follow up sila ng kasama ng mga BHERS, Barangay Health Emergency. Kasama po sila sa initial risk. Otherwise po, nandun sila sa priority B or priority C.
Maraming salamat po, Yusek Kabutahe. Para naman po sa DOH pa rin, meron po ba kayong mga one-pager na mga material or mga short na video na maaari po natin ipamahagi sa ating mga audience na maaari din po nilang gamitin sa kanilang mga parokya or mga organizations?
Yes po. Marami kaming materials na pwede nyo pong gamitin and i-distribute within your respective areas. So for example, yung video na pinakita kanina before we started this town hall, that's one of the materials na we can provide for you, yung top 10 must-know information with regard to the COVID-19 vaccine rollout. And meron kami mga posters, meron kaming mga brochures, meron kaming mga pamphlets. We can give you the site link or the link to our Google Drive para you can download and maybe you can reproduce and distribute to your areas.
Maraming salamat po.
Miss Cecil, dadagdagan ko lang.
Go ahead, Yusek.
Meron yung tayong tinatawag na consent form bago po mabigyan ng bakuna. Ang consent form ay specific sa bakuna. So it will also be good that bago po mag-roll out, para malaman nila ano ba yung mga nakasaad na adverse, ano ba yung what are they getting into when they have a vaccination. So later on, available ito sa ating health promo that they will also provide the consent form. We are endeavoring to do it in many dialects para ho ma-explain. No? Ito po yung sa pre-screening, pre-registration. Maybe we can ask Aldrich kung paano yung ginawa yung consent form. Pero ang final po na consent form, pag nandoon na sa vaccination site, importante po na hindi parang pinipilit sila ng bababakuna. They should understand kung ano po yung pipirmahan nilang consent form. I think that's one important thing that we need to emphasize in this process.
Ayan. Isang dagdag na tanong lamang mula kay Father Dan. Paano daw po yung halal vaccine?
Ang ilalagay din po yan. You can download it sa Philippine FDA site. Yung Sinovac po ay halal. It is certified halal. So maglalabas po din ang DOH kung sino po yung mga halal certified na yung FDA. Maglalabas po kung sino ang halal. But as of now, yung Sinovac po, kasi siya lang naman ang dumating pa, halal po. Yung AstraZeneca, hindi po.
Okay, well noted, Yusek Kabutahe. Sa punto po namang ito ay magpapasalamat muna tayo sa ating mga panauhing mga experts at mga doktor. Maraming salamat, Dr. So, Yusek Mirna, Dr. Kizon, Doc Tina, and Doc Jemelyn, at iba pa nating mga esteemed panelists. Ngayon po ay bibigyan daan po natin ng mensahe ng Pangulo ng Catholic Bishops' Conference of the Philippines. Magandang umaga po, His Excellency Bishop Valles.
Thank you so much for giving me the opportunity to say a few words at the conclusion of this webinar. First, I would like to thank in particular the leadership of our CBCP Commission on Healthcare with Bishop Rex Ramirez, the chairman, and Father Dan Vicente Cancino Jr., MI, the executive secretary and staff. Despite the many limitations imposed on us by the present pandemic, they have found creative ways to continue the work of communicating to us things which are extremely useful and helpful for our present situation. And one excellent example is precisely this webinar that we are concluding today. This webinar titled Ating Alamin, Bakuna Laban sa COVID-19 is most timely and very practical and helpful. Secondly, I would like to thank all of you who participated in this webinar. Needless to say, your presence and attendance have certainly encouraged us, particularly the CBCP Commission on Healthcare, in the work they are doing. Recently, I was asked in a Zoom interview about the background of the call of the CBCP to people to get vaccinated with the available COVID-19 vaccines. And the interviewer asking me this question had the recent CBCP plenary assembly in mind. In that assembly, he perceived that we made that call. And I explained this to him. In that assembly of the CBCP, we were very much enlightened by the presentation of Father Nicanor Austriaco, OP, that made bishops very open to the vaccination campaign. So much so that during this assembly, it became a consensus that we would offer church facilities if needed in the vaccination program. The following day, there was a press conference. And in that press con, I was asked if magpabakuna ba ako? And my response was yes. And the vice president of the CBCP was asked the same question, and he said yes. Based on these two items, that is, our offer for the use of church facilities and our magpabakuna statement, I told the reporter we appeared to have made the call for people to be vaccinated. And I am happy for this. But I continued telling him that over and above what happened and what was said during the CBCP plenary assembly is what the Holy See has conveyed to us. In a note from the Congregation for the Doctrine of the Faith, the Holy See has said, in these very difficult times of the pandemic, when lives are at stake and time is most often not to our favor, that it is morally okay to be vaccinated by the current available vaccines offered to us by health authorities. And I added that even our present Pope, Pope Francis, and the Pope Emeritus, Pope Benedict XVI, had themselves vaccinated. In fact, Pope Francis said that to be vaccinated is an ethical choice. Thus, one may say that from the Holy See, we have the encouragement to be vaccinated not only by word, but also by example. My dear friends, my dear brothers and sisters, I am truly hopeful that this webinar has been enlightening to all of us and has made us also fired up to spread this information to people, to our brothers and sisters in our communities. Maraming salamat po.
Maraming salamat po, Archbishop Romulo Valles, ang obispo po ng Davao. Rex?
Maraming salamat po at bago po natin isara ang ating programa, nais lamang po nating sabihin na kami po ay may isang munting sorpresa sa inyo. Konting katawaan lamang po, gamit po ang electronic raffle ay kumuha kami ng 10 pangalan na nag-register mula sa ating webinar ngayong araw na ito. Excited na ba kayo? Ang 10 registrants po ay makakatanggap po ng gift packs mula sa Unilab at RightMed. Tingnan nga po natin kung sino ang mga nanalo. Ate Cecil, para sa unang nanalo ng electronic raffle ay si
Ayan, congratulations, Efren Karnadang ng Lipa.
si Josefina de Guzman of CBHP, Pagadian City.
Mula sa Nasa Caritas Philippines, Alice Joy Honorata Samoy.
Mula sa Teresian Association ng Haro, Imelda Sebastian.
Ayan, mula sa Kabangkalan, Chris Saidel Caguales.
Ang layo mula sa Philchan. Hello mga kasamahan natin sa Philchan, Sheila Estacion.
Ayan, mula naman sa Makati, bumalik sa Maynila, Mila Suarez.
Ay, gusto kong bumalik ng Cubao mula sa BCBP, Miles Pineda.
Si Elenita Veloria ng St. Joseph FPOP.
At ang kababayan ng ating kasamahan sa External Affairs mula po sa Holy Angel University in Pampanga, Diane Gomez ng Holy Angel University. Congratulations po! Nais po nating pasalamatan ang ating mga partners na nag-cross-post ng ating webinar sa kanilang mga FB pages. Ang CBCP Nasa Caritas Philippines, CBCP News, CBCP Media Office, Aeropagus Communications at ang TV Maria. Muli mula sa pinagsanib ng grupo mula sa Unilab, Department of Health, the Interagency Task Force for COVID-19, CBCP Episcopal Commission on Healthcare at ang Catholic Bishops Conference of the Philippines. Ako po si Rex Dayaw.
Ako naman po si Cecil Rojas, kasama po ninyong nananalangin para sa kalusugan ng ating bayan. Hanggang sa muli po nating pagkikita. Magandang tanghali po sa ating lahat.